everyone for being so patient. We thank Barbara. So now I think we have a motion. We have some legal cases to settle. Do I have a motion on SE 5?
I'll make
This
a
is the
motion.
settlement of Cassis.
Yes, I'll make a motion to settle the Cassis versus the Town of Greenwich case for $75,000.
Do I have a second?
I'll second.
It's easier for the minutes.
And those in favor?
Aye.
400. Okay, do I have a motion to settle SE 6 for Selectman's Office for the settlement of Birdies versus the Town of Greenwich?
Yes, I'll make a motion to settle that case for $16,500.
I'll second.
Okay, those in favor?
Aye.
400. Do I have a motion for SE 7 for First Selectman? It's the settlement of Zarzecki versus the Town of Greenwich?
Yes, I'll make a motion to settle that case for $20,000.
Okay,
And I'll second.
and those in favor?
Aye.
400.
Routine or non?
I think these are all routine. Are these all routine? I mean, the motion will actually come out of the law committee. I think these are routine. You think these are routine?
I do. The majority
Right, yeah,
has discussed it, but it's up to the chairman to decide.
right. So I think,
Just one comment, I think we'll try to make sure that 3 members are briefed by the law department, and hopefully won't have to have executive session Monday if that happens.
okay. So, Barbara, we thank you very much for your time and your team. So, Michael Lynch and Amina Ahmad, who are present for these particular cases. Thank you. Okay, so thank you, Chief McHugh, for being very patient, and maybe you'd like to come up to the podium. I'm sorry?
Sorry about that.
No. We're sorry. So I'd like to come up and I think you have a requested appropriation for $98,500.
Yes, we do.
And so, just so you know, and so the public knows too, I think much earlier today, Roland did look at the accounting for this, and so he separated it into capital
Yeah.
for the engine,
Yeah, he-
and for the remediation, he moved it into operating,
Yeah, we
which is
spoke
how.
out in the hallway, perfect.
Okay,
Yeah, thank you.
so, I just want to make sure that people are aware that, it's the same amount, there's no issues there.
Just doing different lines, okay. Yeah, so just a quick overview, if that's what you like. Recently, they've banned this called PFAS foam. That was an older foam because it has health hazards, possible carcinogens in it. 9 of our 10 fire trucks have these foam cells on it, which is like a 40-gallon foam cell where we kept this foam in. The state of Connecticut was to be in charge of remediation. They were supposed to pay for everything, but conveniently they ran out of money for the last half of the remediation. So we were able to get rid of all of our own foam, which is like these old 5-gallon cans. Those have all been removed by the state, are no longer in our firehouse. We've replaced them with what's called a green foam, which is more naturally and healthier, obviously. So we had, like I said, 9 of our 10 fire trucks have these foam cells on it. So we had a fire back in end of September at McDonald's, West Putnam Avenue. During that fire, it was a small fire with a grease fire in the duct, so we didn't use a lot of water, but we had to use some water for this fire. And when we did, there was a white film coming from the hose line, also off the truck, the discharge line, and it was also on the floor. So we immediately figured that what it was from the foam, but ironically, the line that they used was not a line that could be used for foam, meaning like there's only one line you could pull for foam, and this was not it. So which led us to believe that somehow some foam got into the tank without our knowledge of that, which is the case. There was a small trace of foam inside the tank. It's come back that was PFAS in the tank. We had to call cleanup company. We had to call DEP. Because if we don't notify, this foam cannot be used unless it's for a life-saving issue. So we sent the directive out back in March saying, no, we didn't take the foam out of the tanks yet, but do not use this foam unless it's a life-saving lives. So that's what the state and all of them agreed to. God forbid there's a fire or with a school bus, whatever. I'm just trying to use an example. We could use it. Other than that, you can't use it. So we had all that directives out. We made sure every member knew that. So it definitely wasn't a human error in this fire. So we had to call a cleanup company in. DEP gave us a note, a violation. There was no monetary attachment to the violation, but there was cost for the cleanups. There is cost. We're going to have to replace the tank because it did come in with PFAS inside the tank. So there's really almost no way. They're saying we could clean it out 3 times at 110 degrees, but nobody's going to sign off and say your tank is free of PFAS. So unfortunately, that's where we're at now. So now we're going to go into the fact now of removing all the foam from our 8 engines now, because believe it or not, one of our older trucks just went up to get a tank replaced because the water tank was no good. So they pumped out the foam in that truck already. So we only have 8 engines now to remediate. In the meantime, as a department, we've taken measures on every engine. The foam lever has been disconnected, so we cannot prevent this from happening, except for Engine 1, which is the headquarters, Engine 4 in Glenville, and Engine 8 on North Street. All other engines are volunteer and career engines. This has been done with, so we can't hopefully make that same mistake again. We can't prevent, like if it was a baffle, leaking our baffle that went into the water tank. Unfortunately, there's no way of seeing that. You know, we don't open up the top of the tank, fill on top of the truck every day and check it out. So unfortunately, it's a risk we took. But we had to do, when we saw this foam on the ground at McDonald's, we had to do the right thing, call the DEP in, you know, because if we don't, the fines would be a lot more than what we're asking for here. You know what I mean? It would be in a lot more trouble. So we had to do the right thing, you know, by what's going on. But we think it's important that, you know, this foam could even leak. God forbid our truck gets into an accident, it goes over the ground. So I think it's important we get this done sooner than later, you know. And unfortunately, yeah, we can't do it ourselves because the fact when they take this foam out, they set up all these decon things and they're all wearing suits and stuff like that. So it's not just something we just put our own pump in, pump it out into a drum and just leave it there. So we need to have a professional company come in and clean this and do it right and then move forward from there.
Great. So do we have any questions? Leslie?
I just want to ask one clarifying question that and this may relate to the next item where we separated it, but the request is for replacing one tank.
Right.
But cleaning 9 engines. Do you know whether the tank in any of the other engines are contaminated, or will they be tested?
As far now, no, we've looked into that. When they bring the trucks in, the tanks are all good.
They're all good?
So, yeah.
Okay.
So-
And then this again may be more informational,
Mm-hmm.
but during the budget meetings when we talked, you gave a list of equipment, and I apologize for not knowing the details of the operation.
It's okay.
But there are 14 engines on this list, some of them really old and
Well,
not just for
well,
show.
yeah.
But, so are the 9 covers, what is, the 9 covers
It
all your
covers,
active engines?
so within the Greenwich Fire Department, Liz, we have 10 town-owned fire trucks. That's for career and volunteer. But then Banksville owns 3, and Round Hill owns 1. So those 4 companies, Round Hill and Banksville, Round Hill never had foam in a tank on their truck, so they have nothing to worry about. We've taken their foam, they've gotten the new foam, so they're all set. And Banksville's New York State, so they already took care of this a long time ago. So it's a state ordinance thing, not a town ordinance thing, so.
So there's no issue with the volunteer companies?
Nope, all the volunteer, actually, believe it or not, all the volunteer companies are all set with what we've done. It's the 3 career engines that we have to disconnect the foam. And one of our career engines and our newest engine coming in now does not have the foam cells. We will not have a foam cell in these trucks moving forward, just to prevent this from happening.
Thank you.
And the 10 engines that are town-owned, 1 was taken care of because that was in the
Yep,
incident.
that was just done
So
really the other day.
This is the funding for the other 9.
And one, no, 8, because the 1 doesn't have one. Our newest engine doesn't have one, so it's really only 8 now.
Okay,
Yeah.
thank you.
Thank you for that detail.
You're removing the foam from those trucks and you're getting rid of it. And the cost of remediation is just removing those.
Right,
foam
that
tanks.
is I got the number here. That is at
That, whatever that.
52,000 for ACV.
And the reason you had left them on, just to be clear, was.
The state never really gave us total guidance on it. You know, one of the neighboring towns removed their foam on their own, and then they put the new foam in their cells, and all that foam was no good because it's contaminated. So once it took the 5-gallon containers from us, there really wasn't much more just hold on to it, make sure you don't use it unless it's an emergency and stuff like that. So there was no more guidance after that. Some people did remove their phone, but, also it has to be done the right way. Like they set up all these tarps and suits and stuff like that, and they pump it out, and we don't have that, technology. We want to do it the right way. We want to make sure it's done so we can't have anything come and, and hurt us in the long run.
Laura?
Just two questions. So in our packet, there's a response to the state about what we're doing to remedy the situation. And I'm assuming,
That's what that's at this, Laura, that's at that disconnecting of these. So how you get the foam to the truck, it's a toggle switch. You just move it over, then it switches into the foam tank, and it generates the foam from the tank. We disconnected all those switches.
so I just
except
want
for
to be
3
sure
more.
the state is happy with
That's part,
our
yes,
action
yes.
plan and there's
Yeah,
no
that's stuff we're going
fines.
to send to them as remediation, what we've done in the meantime, correct?
Okay, and then the second question relates to the tank replacement. My understanding is that engine has been out of service.
Yeah, it's out of service until we get all this approved.
So when's the earliest you expect this work to get done?
As soon as they get the appropriation, it'll get sent out immediately.
Okay, very
Yeah.
good. Thank you.
Is there only one vendor that, I'm assuming this is a very niche idea, so do you get multiple quotes for something like this? or is it-
There was 2 quotes for the cleanup you're talking about, Nisha?
Well, any of this stuff, I mean,
Well, we do a lot of our stuff through Gallons, I think it's Gallons a Night. They do a lot of our work. They actually did that last tank and took all the foam out. So they're one of our big we do a lot of work with them. But as far as cleanup, it's only ACV and this Clean Harbors. And Clean Harbors was significantly more money to do the remediation than ACV. And ACV actually did the cleanup too. They did a nice job with that, so. We got a quote from Clean Harbors, like $70-some thousand to do what they're doing.
So I have a question about the state funding.
Yep.
I'll speak for myself,
Right.
plan to support this and all, but I'm wondering, do you think there's any future that some of the state funding will come back? Or
No.
that we could still apply for the state funding with any hope that it could be
No.
reimbursed?
No, unfortunately,
No
Leslie,
hope.
no.
No hope?
Yeah, every meeting you ask, and they're like, it's a state mandate, but not federal. So if we were a federal fire department, we'd have to get rid of our phone. So it's one of those things, but listen, it's what we have to do. We have to do the right thing.
No,
protect
I'm
our
not
citizens.
questioning
No,
that.
I know,
As I
yeah.
said, we're going to fund it. I'm just wondering, if there's, and
Well, that's part of
sometimes-
why we waited a little bit, because we're hoping the state would come back, okay, we have the money to do it, and they never did. And then all of a sudden, we take the foam out, and they come back and say, oh, here's your money, and we already paid the money for it. So we're trying to be fiscally responsible, but, unfortunately, this happened, and,
So I have one other point here.
Mm-hmm.
Now, so the trucks will all be clean. There's no
Yes.
issue. Every single
Yes.
one will be.
Yes.
And so that's great news. But this engine happened to be owned by a volunteer company, right?
well, no, it's not owned by Glenville, it's owned by the town, but it's stationed at Glenville.
So it's used by the volunteers?
It's used by the volunteers, but it's also used as one of our spare trucks, in case one of our trucks breaks down. But it is Glenville Fire Company uses it, as Glenville Fire Company on there, but it's a town-owned truck that, if one of our trucks breaks down, we use it as a spare.
And then is that, just maybe we should be covering this in February, not here.
Right.
But, we're here and so.
Right.
Is that true of all of the equipment or most of the equipment that the volunteer companies, the engines? Like I
Yeah.
know there's some specialized, so they're owned by the town.
Yeah, no, like the Coscop has an engine, that's not owned by the town, that's owned by their company.
Okay.
So we don't use that unless it's an absolute last resort. We have an agreement with them. We have no other trucks available. So we don't ever use that truck to replace one of the other trucks that's out of service. Round Hill only has one engine, so we wouldn't take theirs, and Banksville's kind of New York, so,
Right.
yeah.
Okay. No, I was more interested in the volunteer company engines that are in we'll call it career
Right,
firehouses.
yeah, right.
So pretty much those are owned by the town.
They're all owned by the town, yep, except for Banksville's
Excellent.
3 engines and Round Hill, and Coscop's 1 engine. I'm sorry, I forgot Coscop's when somebody asked that question. Those 5 engines are privately owned. Other than that, everything's owned by the town of Greenwich. All those engines, except for Glenville, when Chief Orzo bought that truck, have all been career engines that just go on to be, that we just swap them out for the spares.
And so you just mentioned that to Leslie. So that engine, was it
41?
Cobb that's owned by
Oh,
the...
21, yep.
Do they have this particular tank? Is this being remediated?
No, they do not, because that's one of, believe it or not, it's one of Round Hill's old engines. So they just bought it from Round Hill, so they do not have foam on it. If they did, we would replace it. We would pay for taking it out.
Okay,
Like any other company would, no doubt.
Okay, great.
Yeah,
No, no,
yeah.
no, I mean, we're just concerned about the safety
Right.
of our sites in town, right? I mean, and
Right.
as well as all the people,
No, who would have thunk that? I mean, I never had foam in the city on the trucks, but, you know, they bought them here, and it was a modern thing to do, and, you know, unfortunately,
okay.
yeah.
Do we have any more questions? Are we ready?
I just
I'm sorry,
wanted to
Karen.
tell you that the Law Committee did take this up as well from a legal perspective. And we do have an environmental attorney that has been brought in to advise the fire department to look at the notice of violation from DEP and any response, to help on policies going forward, to look at the contamination of tanks, because we've heard that they may not be able to be used. So she would be helping to basically work with DEP, hopefully, to get them back into service, disposal, and any other legal matters that might arise. So I know that she's been
Yeah,
working.
I've reached out, she's reached out to me, we talked, we just haven't met yet, but we
Yeah,
have. Yeah.
okay. But I just wanted to advise the BET that that's being done as well.
And can I say one thing, too?
Yeah, of course.
This consultant we have, Osprey Consulting, this guy Bob Graberick, was actually so helpful. I don't know if you guys know of him or whatever, he was really, really, really helpful for us.
That's
So
great.
just giving you a heads up on that.
I also think that the other firm that you mentioned has also been very helpful to the town. I think they're doing some...
ACV?
No.
Oh, Clean
Sound-
Harbors, Clean Harbors.
Clean Harbors.
Yeah, yeah.
It's also been very helpful to the town.
Yeah.
And, you know, you can go look at the Greenwich High School remediation
Right.
site, and it's very clean and... Oh, thank
Clean
you.
Harbor was back in the old days.
Oh, back in the old
It was
days.
back when we first found it.
I knew their name.
Yeah, Roland passed it along to me, so I appreciate it. And I thank you all for this.
So
Any other questions?
Oh, okay, so do we have a,
I'll make a motion to approve FD2, which is an additional appropriation request of $69,650.
And I'll second.
and that's funded in the
That's funded
operating
from-
fund in the general fund, correct?
Correct.
Okay, and so this was, sorry, keep track of this. So this is,
FD2.
no, I understand it, FD2, the new FD2, and, okay, those in favor?
Aye.
400. And do you have another motion,
I
Leslie?
do, to approve FD3, Fire Department's additional appropriation of $28,850, which is a cap coming from the capital and non-recurring fund.
And I'll second.
Those in favor? 400.
Okay.
So you're all set.
Thank you all.
Thank you. I'm sorry? I think that's
Thank you,
routine.
I mean, it's
Routine?
been discussed at 3 different BET committees, so it's probably been, so not routine item.
We didn't discuss the appropriation.
Well, if you hired an
Why don't we
attorney.
why don't we say routine, it's less than 100,000, and if our chairman wants to make it non-routine, he can. How's that? Is that, everyone in agreement with that?
Have a nice day, everybody. Happy Thanksgiving.
Yes, you too.
You too.
Okay, so that's a routine, Pete. Okay, now, thank you, Health Department, for being so very patient, and we will hear yours. And you have 2 requests, and you come with funding for both of them, right? HD1?
Okay. Mrs. Chairman, I'm going to do it. My staff to the left. This is Debbie Edwards. She's now our operations director, previous director of business. And our new business officer is Stacy Cochran. So Stacy's just started a little while ago.
So welcome, Stacy.
She's in the learning phase. So the first I
And
want to
welcome,
thank you.
Caroline. You know, I should have said that. We have Caroline Baisley,
I'm
our-
Caroline Baisley.
the
Yes,
Director of the Health
I
Department.
am. have to remind myself of that. We have two applications. The first application is Public Act. I was very surprised this year that we actually got almost level funding from last year. I didn't think that they would, that they had that kind of money to spread around for full-time health departments, because you do know that part-time health departments don't get state money unless they have a full-time director of health. So for whatever reason, maybe there's more money in the pot. So the first part of the application for Public Act, the application is $122,558.86, a little bit more than what we got last year. I can say that we weren't so productive last year due to COVID-19. We did not concentrate that much, or couldn't concentrate that much on spending our money, but so we have to redirect some of the money that was already in the pot, which is the first part of the application. We're asking to transfer $14,000 into temporary salaries. Those office services that were in the existing fund is the department's public health accreditation money. Excuse me, that's for the application cost. We deferred moving forward with the accreditation, obviously, because of COVID-19 pandemic. And so we had to finally defer the money or change it around and put it to something else. We're hopeful that the state will recognize not only Greenwich, but some other health departments in the state that could not move their application to get to further go through the accreditation process because of the pandemic. So we're hopeful that they'll be a little bit open-minded in the future and give us money to continue the process. The $3,000 that we want to put into telephone and office supplies is from one of our podiatrists who gave services that we paid for services for special need populations. She's decided not to serve this year, or last year, really this year. So we have to, again, change up that money, and that money will go to the latter part of the first application piece, which is $2,400. That $2,400 is explained on the additional sheets of the application. Michael Long, who's been working with Municity, or Environmental Health Services, he was the last part of the Municity project that needed to be concluded, if you will. And his application is for 5 or whatever it is, 5 or 6 handheld iPads that are used in the field to help the inspector actually put down the information on an iPad so they can download it into the computer when they get back. IT pays for the data part of this, but does not pay for the iPad. So we had to buy the iPad, and fortunately enough, the state has recognized the need for this expenditure through state money, so we will use that state money to actually buy the iPad. So as long as that continues, we're going to be in good shape. The other portion of the $3,000 is $600, and that will go towards, again, in the write-up in the next couple of pages, for a copier, more of a copier, not really suited to be hooked up into IT. As you may know, IT's moving along and looking at all of the printer scanner machines in Town Hall to see whether or not they meet IT security standards. So you can't get much for 600. Believe it or not. So we'll use these for our programs, and most likely use them for, copiers, and not hook up into the network. The rest of the monies, which is the $122,000 piece, will go into temporary salaries. One on the next page, $4,800 goes to our medical consultant. Every year, we do go into a small contract with him to cover the STD program, Special Clinical Services Program, the bloodborne pathogens. He does cover the director while she's not there and provides services in the clinic. The temporary services, the billing specialist, part-time within the office. We're trying to advance, perhaps maybe Stacy will be reaching out and trying to look at more ways that we can do for our billing services besides Medicare and Medicaid. And we do have two insurance companies that we do bill. So we're looking to add more insurance companies on that billing. So we're moving along slowly, but we are moving. The next part-time service, temporary service, is a part-time environmental aid, which we've had for many years. That supports environmental services. They pick up beach samples and water samples and pool samples. And that gives the environmental hygienists a break during the summer to hone in on some other projects that they need to undertake. The part-time public health data analyst, we did introduce this position last year. And because of the pandemic, we just couldn't recruit anyone. So that money that was appropriated last year really did move very well. So we're going to add another 16,000 a bit to this position, and hopefully we'll be able to recruit someone. And I think part of the recruitment process problem was probably because we had the salary too low for this particular public health professional. It's a specialized program piece to public health, and we're hopeful to get someone who can come in and do the deed and then be done, give us a report to kind of put us in the right direction as what we should be doing with our data. It's not something that I have no intent to continue to support through state funds. It comes in, they do what they need to do, give me the report, and tell me what I need to do. The last one is a part-time lab assistant, and that is to assist a laboratory division and assist with laboratory director on the testing and some of the other things that we do. The state money, even the COVID-19 money, they stress that public health, local public health, should strengthen their ability for any occasion. In other words, we've been very light throughout the nation, local, state, and federal. And so all this money that's coming our way, they really want to put into strengthening your ability as a department, as an organization. And so you see a lot of these monies going into part-time, part-time positions with the help, with the notion that we're going to get some help to get us off our feet. Of course, fringe benefits is always in the application. And then other services, interestingly enough, the QPR training. This training came from out of a legislative act that required that the local director of health needs to pick a team of people in their community that would be able to train those organizations that actually come against youth and individuals that need suicide crisis intervention. And so, with the money that we have, because $122,000 is a lot of money, we thought this would not only fulfill the requirement through the state statute for the director of health, but also would provide very much good training for our workforce here in Greenwich. And so we appropriated $8,700, and I have gotten quotes from several organizations that have qualified QPR trainers to do the work. So we're very excited that that our staff and those of agencies in the town that actually interact with youth and young people could actually take a course. This does include the Board of Ed.
Can I just ask what the acronym stands for?
Oh, yes, of course. I have that. I knew you were going to ask me that. Okay, so QPR means Okay, question, persuade, and refer. That's what it refers to, and it's an institute gatekeeper training. So in other words, they train the person who really has this interaction with these young people, or any people who have, who are dealing with crises or who need mental health intervention and suicide, obviously. And the Public Act number 21-46, actually, that went into effect in July 2021, actually gives the Director of Health, or directs the Director of Health in any given community to actually provide this kind of training. So we just utilize state funds to do that. The Ability Network is something that we use to file third-party billing. Makes our life a lot easier. We also provide PSAs on WGCH. We've been doing that for quite a number of years, and that has been a good way to promote, positive thinking, to, explain or to issue statements that people need to think about, not so much promoting the health department's programs, but things about COVID-19, things about RSV, which we've all read about, and upcoming things that are walking through the door, okay? The last one, the last one is the Verizon Wireless, what I spoke about for Michael's program, the handheld iPads. And we did use the $3,000 from the podiatrist, and we had to add a little bit more to cover his needs for the iPads. And then, of course, last is the funds used to allow the department to duplicate written material from the health department, the state health department, and the CDC, which we use for public education. Supplies, laptops, our last laptop that we bought with state money has just died. So we're in desperate need of 2 laptops. We probably could have had just 1, but again, money is available for 2. We will work our IT to make sure that those laptops are recognized by our IT department. We don't buy anything unless they tell us that they can support it. And again, another copy machine, scan fax machine. The medical supplies, this year, and with the help of our dental health consultant, Dr. Goodwin, we did purchase fluoride varnish rather than the fluoride rinse for our youth in the public school system. You're probably aware that we used to call it the, swish and spit program. Horrible. But the varnish is used by other, dental professionals in the community. It's easy, it's safe, and this was the first year that we had an opportunity to go in, because we're in full program, to go in and start to apply this to the children's teeth, and it's working out really, really well. In fact, we picked up quite a few number of students, parents that like the idea, and they are signing up for that. The medical laboratory supplies, that will cover that, and 4 portable dental chairs for the staff. Each school, because of this equipment is sometimes too heavy to march from one school to another, and we're all getting old. We decided that each year with Public Act money, we would buy a portable dental chair that we can keep in the nurse's office. And I can't say, by the time I get to all the schools that our services are offered, we have to go back and buy new chairs. But that's okay, because the state is willing to support that effort. And that's, I think, that's the entire application. It's quite lengthy. We try to utilize the money to the best of our capability where our needs are, to meet our needs.
So you also have a second application?
Yes,
too,
I do.
correct?
The second application is for the public
Oh,
health
I'm
emergency.
sorry, I'm sorry.
Oh.
My colleagues would like to ask questions
Oh,
on your
of course.
first application.
Just because you went through it quickly, and maybe I didn't focus on it enough in your application, but your request here is for two parts. One is to do a transfer from last year's uses of grant funds.
Existing money, yes.
And then it's the agreement on this year's. Just, can you go over the explanation again, the change from office services to temp salaries?
Oh, yes. So the office services, that $14,000 was tucked in an account for the public health accreditation application, so that we would move forward and get accredited, and we were doing quite well before COVID-19.
The only question I have is, and maybe these grants maybe are for 2 years, but I looked at what came in last year.
Right.
For this particular grant, and there was no money allocated in 2021 for the accreditation.
Oh, it's been sitting there for a while, for years.
So that means it's before the 21 grant. You still have
Yeah,
access to grants
exactly.
from prior years?
Exactly. Well, I was hopeful, as all of you were, that the pandemic was going to fizzle out and we would catch a break. But as you know, time has not allowed that. We went, the 2021 year was bad. 21-22 year was even worse for the pandemic. So the money's been sitting there, and the state finally said to me, you need to turn this money around. In other words, they don't like it sitting there. They want us to use the money. And I let it sit whenever it hit. I mean, I don't know, I'm losing time, but, the pandemic hit in February of 2020. So it had to be 1920 was the last time we worked on this grant. In other words, that money was for the application.
I
Yeah.
understand, and maybe this is a related question, not that I need to know the answer today, but maybe Roland can help us with this. But how much money do we have in the bank from all of these grants?
Oh, I can tell you
From the
that.
public health grant,
I can tell you that.
the one that's
About
per
a quarter
capita
of $1 million,
allocation.
including this money.
So
So,
that's about an average, about 2 years' worth of a grant right now. It's
Last year, we got 122,000. If we spent 60, we were lucky. We didn't do a lot of things last year. I mean, the 22 of us was quite busy doing what we've been doing
Okay,
for the
so that-
year before.
so now I understand
now
why
I'm
you
at
say
about a
you've-
$250,000. It's quite it's like I said earlier, this is a tall order for us because this money has to move, okay? And if I don't move it in this particular application, they'll take it away from me.
And you have the authority to move the funds to where you need it. How?
Only
do you
through
tip
you.
it- Do you?
Only through you.
You can't change, I'm just wondering how much your actual spending kind of relates to what your intention was at the time. And so you
I can't just
typically
spend
don't
it on
just change
anything.
it.
I would have to, if I wanted to spend it early, let's say the 14,000, I would need state approval to use it for something else interimly, and then I would have to come to the BET to actually move the money. So there's no free-spirited, leeway for me to use any of this money the way I'd like to. There's a lot of restrictions. The State Health Department puts a lot of restrictions, not only on this money, but in particular, our COVID-19 money. That's a whole different ballgame.
That's helpful, thank you.
So I am going to ask, since Leslie headed in this direction and back to this one, I want to ask Roland a question too. Or Caroline, I'm not sure who. There's really two different things here, right? There's one at the top that's only a transfer.
That's right. That's existing money.
And I call that HD1. And then there's something below which is for a grant, accepting a grant for 122,558,
Yeah, that-
and the total expenditures.
And that's
for-
the new
And that's
grant.
new. So Roland, should this all be on one sheet, or should we have HD1, and we'll call it, because we got HD2 today, HD3? I mean, I think that would make it simpler for the future, for tracking this.
We can do that.
Okay, so do we have any more questions on HD1?
I have a question. Thank you, Caroline. So I'm just trying to understand the big picture here. The grant that you received, this is an annual grant, or this was just specific to COVID-19? And it was just
Public
specific?
Act is not COVID-19. COVID-19 is very specific, and Public Act money comes via the federal government into the state every year.
And the reason that Greenwich is eligible is because we have a full-time health director, and we have what's described in the application, you have a population greater than 50,000.
We can't deviate at all from what's written
So-
here in the other grant.
So if it's, assuming it's an annual grant, is there any leeway to be able to utilize it to defray costs in the department? So for example, I'm assuming the answer is no, or someone would have already mentioned that, meaning,
This money does,
like, it looks to me like obviously you're trying to find
it
places
does.
which are
I mean, I think
applicable.
that my budget probably would be a lot higher, if that's the question you're asking, if I didn't utilize state money. Yes.
I guess I'm asking the other way, could you utilize state money to reduce your budget if you were to?
Yeah, so if
to
I
get-
come in
yeah.
at, 1.55 or whatever, if I didn't have state money to utilize temporary services, if I didn't buy things that I need, my budget would be terrible. I don't even want to think about it, how high it would be.
Yeah, but you mentioned that you have of the 250,000 or the grant
Well,
money
the
sitting there.
250,000, which is the highest number I've ever seen in this grant cumulatively, I just added 122 of it, and I didn't spend not even half of the year before's allocation, which was 121, is quite high, and it's only because of the pandemic. I mean, I can only tell you that, for example, June, July, and August of this year was over 500 cases. That's a low number in my world. This last 2 months was like 350. But prior to that, we're talking 600, 1,000 cases, a month. So it's a very difficult number to deal with when we're still trying to keep everybody, on track. We're trying to monitor diseases and so on and so forth. My staff is totally wiped out. I mean, they're exhausted. So I prioritized the needs of this community, and spending wasn't one of them. So I can't do both. I have to take care of the community and protect the community, and our resources of staffing went in that direction. I'm hopeful as we go on the downside, if there will be one of this particular pandemic, that we get back to business and we start spending the money. The state knows what they're giving you. The state knows that we're not spending. I'm not alone. There's many health departments in the state that are in the same boat. But if they don't give it to us or communities, the federal government takes it back. And so this is your money. So naturally, I'm going to take it, and I'm going to make a big effort, try to spend it as designed. And I think we can they can do it. They're going to have to do it. So getting part-time people isn't easy either. That's another hard nut to crack sometimes, bringing people on with the process that we have. And so I can't go over the process of, I can bring somebody on for 6 months and work them to death, and then after that, I got to bang them back to 14 hours, which really is a problem because it just prolongs. The money keeps going slowly after that. But hey, I got to work with what I have, so that's where we are at this point.
Okay, we have another question.
Just very quickly, I think this is a very comprehensive explanation, and I thank you for all of that. But what I'm hearing is that you probably have about 130 or so still left to spend between
Absolutely.
this 122.
Plus 122, so, and this
So-
application.
So I look forward to hearing
Yeah.
more of the active plans on how to spend that money, in addition to some of the public health relating to COVID and
Right.
other contagious diseases. I'm glad you've touched
Right.
on the suicide issue, but obviously
Right.
mental health is a big issue,
The
so.
COVID-19 grant, that ends November 17th. That was the big one that we got for 3 years. I hear that there is another COVID-19 grant 2, that will be coming our way in 2022-23. Application has been made, no approvals have been made. So we anticipate, we have no idea what will be in that grant or how much that grant will be.
So that's good news. I just want to be sure that we're spending the money that we have appropriately and that your department has a plan
Oh,
to
absolutely.
do that and execute it.
Oh, absolutely. I mean, I never turn down money. You know that.
So Debbie, did Debbie have a question? Did you have your hand up earlier?
We have a question?
Just a reminder that
Turn the mic on.
That Caroline does has guidelines of where she can spend the money too. They have to approve everything. So it's not like she can take the money and put, because we do need more than 2 machines right now for the printers and scanners.
You need to talk into the speaker, please.
I'm sorry. So she cannot just spend wherever she wishes. It has to be first okayed by the guidelines that the state gives her, and it also has to be approved by the state.
Right. So shall we move on now to HD2?
The next grant is the Public Health Emergency Preparedness Grant. There's only one portion of this grant that the other part was an MRC piece that needs a separate application and approval process in December. So this is the other piece of that. So we have temporary salaries for the Public Health Emergency Preparedness Coordinator, the security, Social Security that goes with that, and mileage allowance. Now that we're starting to do in-person meetings again, people are, he's traveling here and there to go to meetings. So we're hopeful. It usually is 43,000 and change, but that 6,900 or 6,300 has to have a separate application. And so I have to see what the deal is, how they want us to file that in December. So it's, I just, I need another me to manage all of that, but this is something that is also very advantageous to the town. I do get monies in my budget to keep the person that the Public Health Emergency Coordinator working up until the grant comes in, and then it pays it back. So there's no money to the town at all.
So we thank you, Caroline, for all your great work in finding these grants.
Oh, my finding my money, right.
And sourcing the needs that the town has and that you have with these funds, so that's appreciated.
Okay.
So do we have, Leslie, do you have any questions about this? Do you have a motion?
I do, if you're ready.
I am, and again, I question whether HD1 should be done in one motion or whether it really needs 2 motions.
Well, I think because it came to us in one, let's approve it as one, but I do think it is 2 separate. Maybe as it goes to the full BET, it can be separated. My motion would be to approve HD1, which includes a reallocation of $17,000 for a prior grant, plus approval to use the funds from this year's Public Act funds of $122,558.86. Is that?
As allocated on the sheet.
as
The one is
proposed?
accepting
Yes.
of the grant and the other is the allocation of the expenses.
Yes,
Correct.
so
And I'll second.
Okay, so that's, Leslie and Nisha. Okay, any questions on this? Those in favor?
Aye.
Aye. 400, so Caroline, that's great.
Do you want me to file new paperwork, or?
We'll have you work with Roland on that.
Okay,
Okay?
Thank you.
We'll let Roland make that decision, but don't run away so fast, because
Okay,
we have
thank you.
another one for you.
thank you.
We have and that, we'll do that as routine.
Okay.
And, right, anyone say not routine? Okay, and then we have HD2. Do I have a motion for HD2?
I'll make the motion to accept the grant of $36,368 of PHEP grant funds, and for their use as proposed.
Okay,
And I'll second.
those in favor? Okay, so, we're 400 on that one, too. So, also routine? Everyone?
Yes.
I think so. Okay. Thank you, Caroline.
Thank you.
So, we now welcome Police Chief Jim Heavey and Deputy Chief Bob Berry to present their three proposed appropriations, which have been ever so slightly modified, just to break out the amounts as you requested them, similar to the way Caroline and others have broken out their line items.
Right, so we got that when we walked in, so.
Okay, great. I just wanted to make sure that the public was aware, too. So, anyway, thank you.
All right, so PD3 is a request for $295,000. It's a capital non-reoccurring, and this is for a uninterrupted power supply to maintain our systems, and then also a multi-protocol labeling switching system, which I will allow Deputy Chief Berry to explain to you in greater detail.
So, are you going to explain the details of both of them? Yeah, okay.
The UPS, the uninterrupted power supply, basically all of our electrical systems, communication devices, computer systems, et cetera, run through that UPS to make sure they have uninterrupted power. Critical to run our everything from our dispatch stations, our computer information systems, basically everything digital over at our headquarters has to run through theirs. We actually run two. We've recently replaced the first one, but I've been advised by our subject matter experts that the second one needs to be replaced as well. So it is part of our critical systems to operate the public safety complex. The multi-protocol labeling switch is...
Can we, I just asked, see if there's
I'm
any
sorry.
questions, because there's a whole bunch of things here. So any questions on the uninterrupted power supply? No? So how often do you have, these are like more or less like batteries, right?
Simplified, yes.
Yeah, simplified. And how often or how frequently do you have to replace these? Just, is it, I've heard like every 7 or 8 years, or is it, some other, can you just give us like
The
30
range is
seconds?
about 7 to 10 years, but part of it is having those subject matter experts assess them, assess their health, like any other battery, how, like on your iPhone, sometimes they decay faster, and they just need to be inspected.
And so how long have these been in place about?
The current ones we're running now are at 10 years.
Okay. And so these experts that worked with you, they didn't recognize this issue for the fiscal year '23 budget?
No, this is what they're telling us now.
Thank you. Oh, Laura.
Well, I just want to point out that this item, I don't know if it's the exact same which system, but it came before the BET in 2020 and it was deferred. So I don't know
Yes,
if
it
it's
was.
lasted this extra time.
We are on borrowed time.
We were on borrowed time to begin with, so.
Correct. Thank you.
And also keep in mind, there are two
two
of
of
them. There are two of them.
Which you would hope for some redundancy. It's a pretty critical operation.
So for a lot of them there are, but for instance, our dispatch stations, the way they're worked up, half of them go to one and the other half go to the other. So if one does go down, we still have the capability, but half our stations are down.
How did you discover that it needed maintenance? It was just a regular maintenance that was being done, or did something go down and you discovered that?
We have a
perhaps-
maintenance contract, so that contractor comes in, and when they do their maintenance, they advise us what's the status of the batteries, the battery system.
Yeah, I mean, 10 years is definitely very old.
Yeah.
And it was just an annual maintenance that was being done?
I believe the contract is annual, yes.
It didn't get caught last year, it just got caught
Just
this year?
they come
So
in, they do
whatever.
their maintenance call, and I think we brought them in for some reason. There was a minor hiccup, so when they came in, they did an assessment, and essentially they attributed the hiccup to the need to get them replaced.
And they are like, it's an IT firm that's like an outside vendor that?
It's an outside vendor, yeah, absolutely. I wouldn't necessarily call them, because it's really more of a hardware, and again, and the analogy is it's batteries, so it's not quite IT, but yes, it's in that
Right.
realm.
So it's not an internal consultant, it's an outside?
Yeah, outside
individual.
vendors.
So just as we talk about this, when I looked at your budget, or, the future years, it looked like this was in the 15-year capital plan for fiscal year '25, is that correct?
Yes.
And
So
that'll,
now we're moving it ahead by a year and a half plus 2 years.
remember, there are two systems, and we already replaced one almost 2 years ago, so 25 would be, and again, we don't want to push it to if 7 is this industry standard for considering replacing, we don't want to make it any further out than that, so.
Right, but,
If we do an
But I
assessment and the
assume-
company says, you can go 8 years or 9, we would probably.
but I assume that if you were planning ahead, there was nothing in fiscal year 20, well, it looked like it would go into fiscal year '25. I just make the point because it's not in fiscal year '24 even. Okay, multi-protocol label switching.
So that's actually a capability that's recent. Now, if you all recall, we implemented the new radio system, was initially designed, I think we're talking about 7 or 8 years ago. This MPLS technology was not even present at that time. What it essentially allows our system to do is monitor itself. It creates a pathway. Right now, those pathways are hardwired into the system. And if the system goes down and it can't find a pathway that's already been programmed, then the system crashes. What the MPLS does, it automatically calculates what's the best path for the communications and rewires it that way. And again, that was not a capability available. What we've been having, we initially did not determine what the problem was, but starting a year ago, we started to find problems with the system. It started going down, and this is what it was attributed to. Just in the last 60 days, we've had 2 issues. Just this past weekend, when we had that storm come in, our microwave system was down, but our current system is unable to detect that. With this MPLS in there and with the monitoring through Motorola, we'll be able to know if there's a disconnect between the microwave system and our fiber system.
And there's a lot of computer technology that makes this vital to connect the computers to the radios. Remember, too, that we provide that radio service for the entire, all of the town radios. So it has an impact municipal-wide.
And that's a great point. So it's not just the police radios that go down, it's fire, it's EMS, it's Public Works, it's the Board of Education. Everyone's radios go down.
But this says to strengthen the network in the future.
Well, one of the challenges is that these switches, the ones for this requirement, we don't have a spare on the shelf to replace one. And we did have spares that we used to extend the life of the current system, but we don't have something to be immediately replaced. And as you can imagine in the current environment with IT, having a back order, a part on a system that's critical to communications for the entire municipality would be ill-advised.
I think part of that strengthening too is, again, so this technology is able to predict or identify where there's a problem and reroute it. So that's that added robustness to our system.
And this radio system, I mean, I'm sorry, Nisha, were you ahead?
That's okay, I'll go after you.
This is the Motorola system. Is this system, you're setting this up with some, we'll call them enhancements, I guess. Is this radio system from, it's Motorola, going to continue and it's current and all this stuff, or is this going to need to be replaced too? I mean,
So in our discussions for our 15-year plan with Ben Brainian, is that we've actually identified an amount of money in early budgets years to start looking at what we will do for a system. Because I think one of the challenges is that we often wait till a system's on its last legs and then are kind of putting Band-Aids on something to keep it going. And we can't operate like that. It's a vulnerability. It's a risk that's not worth taking. So we've identified a vulnerability, and we've also, like I said, in our 15-year plan, we're asking for some consultant fees to look at what our next system will be. These systems probably have a 10 to 15-year range, but we don't want to be caught short because we didn't take care of the system. And this is you might be able to say it's an enhancement, but it's also a security measure to maintain the system at all times by having that ability to reroute communications to make sure that it works.
Our current contract with Motorola goes for about, I think it's 3 or 4 more years. We'll probably end up having to do a bridge from there, but as the chief mentioned, we don't know what the next technology is going to be. It could be satellite-based, it could be 5G. We just don't know that at this point.
So who actually manages the work when this is going to be done? I mean, do you have the resources? I know we used to have Captain Cordick, but someone with the experience, I hate to say this, but
Well, you did. We have officers who are technicians in that area, and we also have an outside vendor who assists us on a regular basis and has done so for many years. And then we also identify that, as we said earlier, with subject matter experts that come in and give us a look at our systems to give us the best. We're policemen, we're not IT people, but we
No,
recognize
I know that.
that.
That's why. I mean, that's why I can't understand why there isn't, maybe some of this work, maybe more working with the IT department as such. We tend to be like a lot of fiefdoms in town.
I think you should ask Tom Klein that, but he'll give you a really good answer, but, he will.
But part of that is, while there's obviously some overlap, but the technology for the radio system is a little bit different than what the town IT department really works on.
I agree with that.
And what we do is we hire a consultant, and one of the things that, for instance, that consultant suggested to us that we're putting in the proposal for this MPLS is that Motorola, and through its local vendor, which is Norcom, based here in Connecticut, would actually take this proposed system, put it into the laboratory, and test it to make sure that it would fit in, so if there's any issues or whatnot, before they actually attempt to install that. So we do seek to get that expertise from other experts before we get these requests for proposals.
And they'll assume the maintenance of this component of our important system going forward.
I'm sorry, which one of these assumes it?
Norcom.
Norcom.
Who is our Motorola vendor, will assume that the maintenance of this component so that its utilization is optimized.
And it's maintenance, but perhaps even the more telling thing is the monitoring. Because right now, again, when that microwave system went down this past weekend, it took us a while to figure out what was going on because Motorola doesn't currently monitor that. So with this new MPLS and their monitoring, we'll be able to have a quicker identification of what the problem is so we can get quicker fixes.
So does that have like a software package equivalent that becomes an annuity that you will be paying every year?
It's going to be into that maintenance contract that we already have with Motorola. And I'm sure when this window comes up again in 3 or 4 years, that'll be part of what they come back with us.
Nisha?
I just wanted to get some clarification. So looks like to me what happened is when you install this new radio system, prior to that looks like you were on fiber to communicate, and now that you're on radio, effectively this is a switch. So when the radio goes down, it goes over to fiber and vice versa, kind of similar to technology. If you have a double or a single, like your redundancy. This is allowing you to switch over from A to B when A goes down.
So
Is that-
currently, what we have is it's actually a microwave connection and or fiber, or in some cases, at some of our stations, it's both. Some have a single, some have a dual. So what this technology allows, for instance, we have actually two antennas in the backcountry of Greenwich. One of them is connected solely by microwave. The other one has both fiber and microwave. So what this MPLS will do is if there's an issue with the microwave, it'll automatically switch over to another path.
So if you don't, just to be clear, so if you don't have a switch, normally what you would do is you would manually go from A to B. Is that what you've been doing?
Or
today?
it has a pre-programmed algorithm in it. So if X happens, then it will do Y. But if Z happens and it's not programmed in there, then the system goes into fail mode.
I'm just trying to understand, because you don't have the system now, what's the current, when things go down, there's no solution right now? It's just kind of.
Well, again, if it has a programmed pathway, it'll switch to
It'll
it.
switch over,
But
yeah.
if it's not a programmed pathway, it goes into fail. We have to figure out what's going on
Yep.
and fix it.
And then, just to be clear, this 250 is the actual equipment cost, and because the maintenance is built into your Motorola contract?
It's some for hardware. A lot of it is the expertise to install it. When you actually look at the breakdown, the equipment is actually probably a quarter of it. A lot of it is the software, the installation.
You expect this to last, like you just mentioned, technologies change. You expect this to last 3 to 5 years, and then something else comes about, and you're going to have to.
And that's what we're kind of already thinking about. And we've, as the chief mentioned, that's why we want to kind of put that placeholder in there to help us figure out what is the next technology.
And my final question, do you have a sense of kind of is there like peer sharing that goes on along, like for example, how does Darien do it, how does Newcastle, is there a discussion?
So one of the
other
things,
departments do it?
so our associations with the Fairfield County Chiefs and the Connecticut Chiefs, we do discuss that stuff all the time. And some of the resources may be that we might be able to use some state resources for antennas or for the duplication of the redundancy system. So we're still looking at that. And the Fairfield County Chiefs actually has a fund that we've used on a grant to have an outside subject matter expert discuss how we can do that going forward. So, and it's not just for the individual towns, but also for our mutual aid responses to our other communities. If Norwalk needed assistance or we needed assistance, how we could better do that. So that's definitely one of the aspects. And I know I mentioned Tom Klein before, and then he walked in. He must have been monitoring us on the IT section. So.
Well, we're on television and YouTube Live, as you know, 2 television
Oh, yeah.
channels. I think Laura had a question, so I don't know, I don't mean to interrupt, but whether you're going on to another topic, staying on this, finishing up, and then Laura.
I have a very relevant question. It's about the quote. I'm looking at the quote. So it's about 232 for the equipment, the installation, project management. So my question is the additional amount to get us to 250 contingency, or is it partly some of the maintenance in the line below that?
It's a little bit of the maintenance, but frankly, every time we go to Motorola, we get a quote, we come back, because it takes time for us to get approval and whatnot, and then the prices go up. And we've gotten kind of caught on that a few times. So some of it is to address the anticipated, since we've been talking this proposal with Motorola for probably about 5 or 6 months now.
Yeah, this is dated June 3rd, so, okay, so it's safely, it's contingency.
Yeah.
Okay,
Yeah.
thank you.
I was just going to comment to your last question. One of the other challenges we've always had is with our geographic location in the state. The state primarily looks at putting their communication systems, Hartford, New Haven areas. Where we are has always been a challenge. We try to look and see what Stanford does, but we just often get just outside of those footprints that the state puts down. So that is one of our
For your
challenges.
own, yeah.
Any more questions on this?
Tom's here, do you want to ask?
Which question?
You asked about IT, we should be monitoring
I think if he wants to take over the radio system, was that?
No, the radio system, I was asking about a timing thing, so I'm
Yeah, I guess,
I'm not concerned about that one.
Can I ask, just because Tom is here, because I was kind of thinking kind of on a similar path, is there anything in our current department right, that you could leverage that would kind of, I'm sure there are a lot of switches down there. I mean, I'm assuming they're totally for different purposes. Is there anything existing in our IT world that you could leverage that would kind of serve a similar purpose?
Sorry, let me stabilize that. Can I get a chair?
It's an IT issue, perhaps.
No, so I had looked through this, and I looked up MPLS, and then, and I think what's going on is radio technology is very different than what we work with. So we work with workstations and phones, and I would say business types of devices. And when radio's involved, it's different protocols, and you kind of move to this next layer. And I think you either pay for not having this system or this new protocol with labor, and it's usually labor when something breaks. And so you have an outage, and then you have to kind of scramble to fix it, and you pay for it in just kind of coming up with what's wrong. And then I think it's this time where there could be an emergency, and probably is an emergency where the system's not functioning properly. So so that was my takeaway from it, which is it's different than what we use. It's different locations than what we have. So we have 30 locations, and they are civic centers and firehouses, but they're not like a backcountry radio room, not on our network. So these are things that it's different technology for a different purpose and different locations. And I don't think, so we struggle to keep people that are knowledgeable about the switches that we use, and I can see how other entities and how you would struggle to have vendors to come in and have that expertise. It's a tough environment to keep that, and we're looking at the same thing. If we lose expertise, we're pretty thin, so we would turn to a vendor, and we're trying to build relationships with vendors to contractually, maintain systems. So I do understand this.
So, Deputy Chief Barry, when would the work on this project begin?
As soon as the, funds become available to us, we'll look to close out that proposal and get it going. Ideally, we'd like to start it in January, but all subject to the availability of the funding.
Any more questions? Okay, so shall we move on to PD4? And that is, once again, we've broken them down or Roland has shared. We broke them down into the 3 items. But actually, let me just step back to the previous page. The PD3. I want to make a comment that while this sheet for PD3 says 290,000, when you add up the 2 items, uninterrupted power supply was 45 and multi-protocol label switching was 250. So the combination of those 2 sheets is now $295,000, not 290. So I just wanted to make that comment. And that change was made by Roland today, and so that anyone was thinking 290, it's 295. No, I think we should do them all. Please. And just, like we did. So the next one is broken down into 3. Cybersecurity for $55,000, thin client replacement for $47,000, and body-worn cameras for $40,000. Again, as the information on your page 2 presented, but just on the same line items like we had on the others. So I guess cybersecurity is the next one. Is that correct?
Yes.
Do you want to explain anything?
Chief, did you want to, or no? So what we're looking to do, what we're looking to do is to get some different systems that are actually recommended between 2 avenues, between the Cyber Defenses, which is now Apollo, which has been working with Tom Klein and Town Hall IT for a couple of years. They actually just were able to conduct their assessment of our internal network in August of 2021. Based on their report, they identified several capabilities that they felt we needed to make our network robust and strengthened. We also combined that with some similar recommendations from the state of Connecticut and the FBI. A lot of our criminal justice information systems are subject to their requirements. Based on those, we created this menu of cybersecurity products that meet both of those, or really all three of those different requirements.
And again, the other issue that's come up is whether or not the town IT can operate our system. They certainly are a valuable asset for assistance, but because of the different levels of security, there are things that the current town of Greenwich IT department can't support us in this particular area. But we are trying to meet the standards that are identified by them for our internet-connected computers, and then also to meet the requirements by the state and federal government for our CJIS, our criminal justice information computer systems, which are very different.
I'm sorry.
So I was just, I mean, again, I'm a little bit out of my area. Maybe other people have questions here. But it's my understanding that Cyber Defenses originally started as we'll call it a government contractor, that was their base. So are they, or through their own network and now Apollo, another larger organization, able to do this, or do they need to bring in a third party in order to execute this?
So what they recommended to us were certain products, most of them commercial products, not necessarily theirs, in order to buy the capability. We looked at their initial recommendations. We thought they were a little high. We had our internal IT consultant look at them. And in that case, he was able to get us either the identical products that they were recommending or similar products with the same capabilities at a much reduced price. So we're able to get the same capability, less resources.
So, again, I'll speak to my own, there are certain things that we do separately throughout the town, and that's great. But cybersecurity is something that's new and critically important to all of us. There's no question about that. I wish I had the support of the town, my home, in terms of things like this, the cyber. But is this something that should have centralized, we'll call it policy, processes, control, and rather than, say, providing this money to the police department, that we do the same $55,000, but this money be provided centrally through the IT department? Because that was the original plan with cybersecurity. It was going to be very centralized. It's a new business for us. It's not Tom Klein's traditional IT business. I mean, we all know that too. But we're very fortunate that Tom is highly knowledgeable on this too. But question, should it be centralized rather than, and I don't know who the person to answer is.
Let me try to take that on. So just let me rewind first a little bit, and that risk assessment was not an IT initiative, right? So the assessments is a risk, comes from the risk department, and which is part of finance, and then reports to the audit committee. So this is really an audit committee initiative. And we have a steering committee. We just met, in fact, 10 minutes ago. And we meet monthly, and it's Ben Branyan and Megan, the risk manager, and we work with Apollo and we work through the issues. And what we're really striving to do is to centralize a report, a standardized report across all the entities, to give you a sense of identifying the risks and how they are being remediated. But how they get remediated is very localized to the entities, and there's no escaping that. It's not like I have some magic way to understand all the police technology and that I can know more than DC Barry and the chief know about how to remediate what they need to remediate. So putting the budget within the IT budget, I think is somewhat misplaced, because now I'm being asked about technology that I don't have expertise in, I don't have resources for, and I'm frankly not charged to make that remediation. If you wanted to see it centralized, you might think of creating another budget. So instead of the IT budget being 134, you create I don't know if 137 is taken, but you create something else and you put it there, and then you task someone, it could be the risk manager, to be in charge of that budget, or it could be, or I could take that on as well. But the point is to keep that distinctly different, and then to, again, treat it as the IT, I'm sorry, the risk management function in cyber is to do the identification and is it raining? And to track the remediation. I'd rather see it go that way, but again, the remediation's done locally, budgeted locally, can be identified that way. But if you want to see certain things centralized, by all means do that. I mean, it gets to a point where if you're talking about upgrading switches as part of remediation or to make things better, it's not really cyber. If you're talking about multi-factor authentication, it's cyber, but it gets executed within systems. And it's hard to take that piece of budget out.
Yeah, so look, I agree with you that cyber is different than IT, but I was just trying to find a closer home. And I also think that this kind of conversation really isn't meant for the November Budget Committee meeting. It's really meant as a discussion topic in our Budget Committee meetings in February, to be very honest with you. But nevertheless, I think it's worthwhile talking. And I guess, is it misleading to call this $55,000 cybersecurity if it's not like the consulting or whatever, and it's like the, hardware, or whatever we want to call it? And are we then properly, accounting for it? I mean, I guess it's an operating expense.
So, again, looking at the assessment that was done by an external entity,
Right.
identified vulnerabilities, the lack of action on it will only result in consequences. We can minimize or mitigate the consequences by taking action on trying to stop any, to reduce our vulnerability. So we think that it was important. It was an outside, again, Apollo reviewed our equipment. It took some time because of the requirements we have with the state. They had to be fingerprinted, and it took longer than almost any of the other assets. But if I put on my emergency management hat, we've had wastewater and regular water cyber attacks in local areas. Unfortunately not Greenwich, but cybersecurity is part of every single asset or facet of the town, and we want to make sure we minimize our exposure to this.
Thank you. Leslie?
I just wanted to reiterate the support for this effort. I think we all believe that trying to minimize any potential threat from cyber is really critically important. We have, as a town, spent significant resources in terms of both time and funding across the town for this. As the chief just mentioned, the police department was a little delayed because of approvals, but they're here now asking for the request. So I think this is something that is consistent with what the BET has done and certainly needs support. I think that there are a variety of things here, both hardware as well as software and just practices. And I think it's incumbent upon the department to make sure you've got the person who's got to focus on cyber and the implementation of this and monitoring of this is going to go through the task force to monitor progress, because that's what the task force talks about. But I think this is in line with what we expect to happen.
Okay.
Leslie, can
Nisha?
I think, from the discussion that we're having, I think what my colleague, Ms. Tarkington, is trying to say, and I think, correct me if I'm wrong, Leslie, Tarkington, is I think there's two discussions. One is just the accounting of how do we account for cybersecurity? Does it sit in your bucket? Does it sit in your bucket? Which department? We all need it. Every department needs an allocation to it. And got it, Tom, and I totally agree with you there. But I think because it's really not my purview. You're the chief of the department. If you feel this is necessary, I'll defer to you on that. But I think what we're trying to at least come towards, or at least what I think Leslie was trying to allude to, is are there any efficiencies that can be found if, for example, like in the previous case when we discussed the radio, Tom's like, nope, I don't want it. It's not my technology. It's not something I've ever done. It's just, you're expanding my pie. In this particular case, this is cybersecurity, which is really implemented throughout our departments, whether it's the police, whether it's schools, whether it's our town. If there are certain efficiencies that can be found, and Tom, not to add any more work to your plate, leaving the accounting aside, if it's something that would make sense for your department to take on, maybe the cost doesn't change much. Maybe the cost is just going from bucket A to bucket B, but perhaps, we don't need that third-party consultant to give us that insight. Maybe your department already has that, and you also have a better understanding of how different pieces work within our network. So I think to the extent that there are efficiencies, and I don't have any way of knowing if this cyber or any of these specific items, I think that's kind of the spirit of where Leslie was coming from, if there are efficiencies that IT can help with. Because we see this not only in the police department, we see requests that come very specific. I need this, I need the cellular towers, which come from the Board of, and they're kind of all come into we need a tech advisor in some sense to give us it. So I think if to the extent that there are efficiencies that can be found and you think you could take it on, you meaning the IT within the town, it would be great if you could comment on that. Yeah. I think you're saying no, but I'm not sure. Yeah.
Yeah, I'll just say it in a nice way.
Yeah.
No, now I'm on. So, yes, I am saying no, but I'll say it in a nice way, which is, and it's really just from being pragmatic.
Yeah.
Which is, it's a very different technology. I mean, I could say the same with the schools. Very different technology, very different devices. I have no problem, for example, for Board of Ed, Mike Ting and I agreed we're going to meet every 2 weeks and just discuss. As a CTO, he has more of a technical background and more technical just approach, and the CIO have a different approach, it's more budgetary. And I think there's opportunities for have discussions and see what information we can exchange, but we're under no illusions. We have a very different client base, device base, where the systems are located. And the same here, where I think when I look at that protocol, we don't use it because we don't need to, because radio kind of brings in a just completely different mindset. And I think we have a challenge too, in the labor market of finding people qualified to really handle these systems. And I'll just say it now, we have 2 levels of employees. We have the traditional employees with the pension and have a very different mindset of how long they're going to stay and how long they're going to, and the institutional knowledge they have. And then there's the newer employees, which are more just mobile, tend not to stay as long, and don't necessarily come with that institutional knowledge. So really what this is that kind of knowledge. So we have, right now, very strong institutional knowledge of what we support, but within 5 years, maybe even 2 years, that might go away, and we're going to be looking at bringing in vendors to do that. When we look at vendors to do that, maybe there is opportunity to say, well, if you're using a vendor, we're going to use a vendor. Yes, I think those opportunities can come along, but I don't see that happening in this budget cycle, and maybe not next budget cycle, but something we can be mindful of. So there's your no, but to say certainly can stay open-minded about it, especially if we end up having vendors fill the gap for not being able to attract the type of technical expertise that we need.
I would just add one thing to qualify or quantify that a little bit is we already overlap with Town Hall IT. The systems that we utilize are on his network, our public internet, et cetera. So we already do try to get that economy through them. It's just the closed systems separately that we maintain. On most of our workstations at GPD, there's 2 computer networks. There's the town network, which we work collaboratively with Tom and his staff, and then our separate in-house one that does our criminal justice thing. So I just want to emphasize we do work with them quite extensively on our town portion, the public internet.
I just wanted to say, in my first term, I, along with Deborah Hess, served as IT cyber liaison, and we had many meetings There was a vulnerability analysis done. There was a project plan put together. There's very specific areas where we needed to work on. We've been plugging through. All along, because of this closed system that the police department has, we knew that there was another level with the state that we had to go through. So to me, this sounds like we're implementing a plan that we've been talking about, and we shouldn't discuss the particulars, but I'm very happy to see that it's moving forward. So I just wanted to say thank you.
And I have one more question. If the consultant did this in August of '21, and I know we're all suffering in the COVID environment, but that's 15 months ago. Why wasn't these requests then in the fiscal year '23 budget?
So I could speak to that a little bit. So August of 2021 was when they actually got their approvals, and that again comes through the FBI, the state police, et cetera. They came and hooked up their equipment. So they did their testing. It took them a few months to prepare their reports. Once they submitted their reports to us, it took us some time to analyze it. We talked about it with our subject matter experts. And again, some of the recommendations that they provided we thought were not the most efficient or beneficial to the town. So we sought some alternative opinions, and that was successful for us. So unfortunately, it did just take some time.
So we ready to move on to thin client replacement?
Sure.
Thin
so-
client replacement.
So thin client replacement should not be something that you're not already familiar with, as it was eliminated from this year's budget. When we met with our liaisons, Mr. Azamir and Westbroad, we mentioned to them early on, maybe 6 months ago, that we were going to probably have to come back and ask for an interim to address this vulnerability if it got to the point where we no longer had spare thin client units available to replace at our workstations. We have approximately 100 workstations within the building, and this thin client is, I guess, trying to explain it in the easiest terms, is sort of like having a CPU for a regular computer, but it connects us to the server on the police, the law enforcement, criminal justice side. And that particular technology, it is over, I think it's almost 12 years old, and we had asked to replace that. We had some spares. It was eliminated from last year's budget. But again, the vulnerability has increased, and it will start to adversely affect operations when we have to close workstations down. We've kind of taken all the spare parts we can. We've taken to cannibalizing into areas where the workstation isn't used frequently. But again, at this point, it's going to start to affect adversely operations. So that's why we've returned to ask for that, because we don't want to wait until the next budget cycle, because it just can't wait that long.
Another aspect to that, and it's kind of tied to the cybersecurity. We're being told that the cybersecurity products that we want to install aren't capable of being run by our current thin clients, because again, as the chief said, they're 10 or 12 years old. So in a way, they're kind of tied together.
I just have an accounting question. When this item was cut from the budget, it was a capital item, and now it's being treated as an operating expense. Roland, is this one of the ones you're moving from capital to operating?
When you look at the per cost item of these and that they constantly get replaced, it's more of an operating than it is a capital.
I'm just confirming that it was treated one way in the last budget cycle, and inter-year, we're doing it a different way. So I'm just confirming the accounting. So in the future, you don't have to come and ask for a capital item, it's in your operating budget.
Although,
We never know, like, we didn't know where these were when we came in here. There were already different sheets when we arrived, so we're flexible, though.
So I will make a comment, though. We are tracking what's been moved from traditional capital to operating to make sure that once we set it up, it continues to be used for those capital items, and that, it's not considered a separate operating item. So Roland is keeping those in separate line items, and we do have a record over, these moves to kind of, at least we'll be doing it continue to do it this year, as we've done over the last couple of years. So even though they're going into operating, they'll be tracked in separate line items too.
Is there something we need to do different?
well, Roland will help you if you need to do anything different. I think it's mostly us, to be honest. But it means that the money isn't, once it's in your operating budget, it's meant to be used for these kind of things in future years. It's not meant to be used for something else in operating.
Leslie, just quickly on this one. Is there, I know, Tom, in your world, you lease a lot of your equipment. Is there any opportunity for your department to lease any of this equipment, just both from a costing, maybe, I don't know, if, Tom, you want to answer that, but.
I'll just say this. We've struggled with this for many years. We wanted to get away from this mode where we would ask for a lot of capital and then, so it's not only we're asking for capital and then there's years where we're not, and then it comes back again. But it's also, how often can you replace these and what kind of cadence can you set up? So our goal, and we're not there yet, is we're almost at 5-year leasing, right? So it used to be 3 years. We've worked it down to 5 years. And then our goal is to every summer replace 200 machines. We have 1,000 machines, so if we can get to that. It might be in the short term that one leasing schedule, we might kick off to 3 years instead, or 4 years, or 5 years in order to get that. But that's our goal. So we have a steady stream every year in the operating budget where we're essentially replacing 200 machines. And it's all being done through leasing.
I'm saying for the police
Yeah.
department.
So
Does
could
it
that
make
get
sense
done?
to think about?
I think long-term you could do it, right? But in the short term, you might have a buildup where you have to do it now, but then you could kind of work through what's the plan for maybe 5 years from now being on a schedule that's more operational.
And not to, it's $45,000. It's,
I'm not, I was talking about just the overall,
Sure.
your overall environment.
Yeah.
We just talked about a switch, we talked about other equipment. If you think about your entire technology infrastructure, I don't know what that cost is, but you don't, when you come to us, it's very clear it's an operating, recurring expense. It's not a big capital request every 5 or 10 years. A lot easier to say yes to.
No, we can certainly look at that moving forward, absolutely.
Are we talking about buying versus leasing? I mean, can you lease in the police department? What?
You can lease, in technology, it's often the preferred route, so you just
I know, that's why I was asking
Just for
the
the tech,
question.
I don't know how much infrastructure, 47,000, you're right, doesn't make much sense, but if it's a larger number, you absolutely could, especially the switch we just talked about is 5 to 10 years. There's a lot of different pieces, especially if the time frame for everything is limited. It's just a good thing to think about because you get new stuff all the time. and-
We'll certainly look into that.
Body-worn cameras?
So body-worn cameras is under Public Act 20-1 are mandated for all police officers. And as you know, we were able to get a small refund on the amount of those that we purchased prior to the enactment of the law. And then we had a secondary requirement due to the police accountability bill that required us to do dash cams for the police cars. So we kind of stopped the body-worn camera operation implementation. Other than providing them to all of the active duty police officers, we did the dash cams. And now this is the last requirement for us to complete so that we have our special officers who are certified police officers. And although they are part-time in nature, they are still required to have them when they interact with the public. Again, in the 11 years I've been chief, I seldom come to interim, but we thought that while we were doing this, we would try to put these together so that we could resolve the issue, be in compliance with the state statute, and not bother you again on an interim basis.
So when, Chief Eby, when does this mandate go into effect for, these sworn special officers?
July 2021, it's already in effect.
For the sworn special officers, I'm not talking about the regular force.
It's already in effect,
And this is a state requirement,
yes.
and what kind of progress are other police departments in the state making towards this?
Again, it's a mandatory requirement. I know that some departments are still having a challenge with the dash cams, but I don't know any that are currently having difficulty with the body cameras. And as you recall, we received a grant of about $113 back for the body camera program that we implemented almost a year and a half ago. And speaking of leasing, our body cameras will be, due to the contract we have, they'll be being replaced in about a year. So we always stay with the technology, the way that the current contract is with Axon for the body cameras.
And I just, this is to purchase a pool of cameras that when a special officer is called into service, it's not one for one, is that correct?
Right, no, we just doesn't, it's not practical for us to have, because they don't all deploy at the same time, but, they are our backup. And the unfortunate, the funeral on Monday for Lieutenant Pannone, a number of the specials came in and filled in police roles for the day so that officers could attend the funeral and to assist us with the crowds and those types of things. They come out in emergencies. Many times they are with a regular officer, but then there are times when they're not. And that's, we didn't have enough of a on-shelf pool with the number of special officers we have, which is a very valuable thing. They provide thousands of hours of volunteer service to the town. But for us to be in full compliance, we need to make sure that there's additional cameras so that when they're out doing police work, whether it's fireworks or parades or augmenting our patrol staff, that they have the cameras.
So one more question on this. On these body-worn cameras for these sworn special officers, do we know, say, what their value is per billable hour? So now that we have these additional requirements and these additional expenses, are we looking at these additional expenses when we're talking with, pick a private school or something, when they're using the services? Are we adding these additional capital costs or operating costs that we're incurring to the billable rate for their services?
No.
But wouldn't that be wise? Otherwise, we're putting more and more burden on our town residents to pay these expenses.
So as you're fully aware that 5 years ago, I implemented a plan to bring all of the side work done by both active and special officers for the town, and there is a $5 an hour fee that the town obtains, and the town has received over $2 million from that pool, that money coming into the town, and that pays for the person who manages it, and so there's a considerable amount of money that's coming in from that added work that the officers do in private duty. So I think it more than covers the small amount to be in compliance with the state statute. The special officers provide thousands of hours of volunteer work that would otherwise cost us a considerable amount whenever there's a special event or when there's emergencies and we have limited resources in town. Many of them live in town and are able to come back and assist us in an emergency. So I think there's plenty of revenue from the side job account to cover any concern about a cost that this item might have on the special officer's uniform.
In the past 5 years, have we increased that $5 fee? No, it's always been stable in 5 years?
It has not changed in 5 years.
So, next project. So now we're going on to PD 5. So I'll add that initially it came in last month, but it was very late, and so I think we met with Deputy Chief Berry after sometime at the end of the month, very end of last month. And so this is a new additional. These are 3 new projects that you've now added. So let's go through. The first one is I guess the device itself has taken the name of the brand. Is that?
Kind of like a Kleenex and a tissue, perhaps? Yes. So if you want me to go into a little bit description on that.
Just before we start to talk about the details of these 3 items, these are from our equitable sharing accounts, which is a money that the police department receives and is limited in its scope to provide enhancements to the service level of the police department. We can't supplant any budgetary items. These particular items are going to make us more efficient, more safer, and provide and when Deputy Chief explains the Faro device, it'll actually probably not only improve our delivery service. It will also perhaps have a cost savings to the police department when we investigate crimes and accidents. And the device will also be available for other departments who this device will be, can assist them in engineering projects.
So let me just go through, as I did on the two previous. This one is a little different because you didn't put the numbers here, but they're on the front page. So this particular PD5 covers the Faro devices, plural, or
It's a single device.
one single, okay, single device for $60,000. It includes ballistic shields for $10,000. Is that one or many?
That's several.
Several.
No, actually, believe it or not, it's one.
Yeah, I kind of read it. It looked like it was only one.
Unfortunately.
And a server AC unit, air conditioning unit for $25,000. So we'll start with the Faro device.
So the Faro device is a laser scanner. For probably the previous, I think it was 8 or 9 years, we had another system. It was called a total station. It was what the state police used. And essentially, that's when you get to either a serious collision, a crime scene or something of that nature, and we were trying to reconstruct that scene, measurements and whatever else. The previous system that we had after, again, 7, 8 years, it finally is unserviceable anymore. Contractor won't fix it. And to be quite frank, it is really dated technology. This, the Faro machine, and again, that is a brand name, it's a laser scanner. So basically you put something that almost looks like a miniaturized R2-D2, to use a phrase, and it will start doing its calculations, recordings, laser measurements. It only takes a few minutes. If you have a large area, you move it to 2 or 3 points in that area, and it takes those measurements. It gives us a extreme higher number of accurate measurements, so it's a much, much better product, but it also enables us to get that product in a much shorter period of time. So if we have a road closed for, say, a fatal accident, previously it might take us a couple of hours to get that scene fully documented. With this device, we can do it in probably under 30 minutes. So obviously, that's better for the community, cuts down on road closure time. It's also safer for the officers and the public. That's where sometimes we have accidents where people, see the closed road, flashing lights or whatever. So the quicker we get out of the roadway, it's better for everyone. This technology is currently used by the states and many of our other fellow agencies in our county, so it kind of gives us that ability to share products, reinforce one another. So it's really catching us up to what's the current product.
Amy Siebert and Jim Michael from Public Works are excited that if we have this device, that they'll be able to use it for assessment of roads and bridges and other of their projects. So by placing this in the towns, by us obtaining it, it'll be an asset the town can use in other areas as well.
The Fire Marshal Division also expressed interest in it. So that was one of the things. When we had the product demonstration, we asked the other departments to come in, and we do look at it as a resource across the entire town, not just the police department.
And the cost would be covered by our equitable sharing account that we've not touched in a number of years.
Questions? No more questions. Okay, so the next one we have on this is, I think, ballistic shields for $10,000.
Singular.
Oh, singular.
Right. It's a single shield. It's pretty straightforward. It's a single shield. Our current shields do not have a capability to stop all firepower right now, without going into a lot of detail as far as our capabilities. This one gives us a capability that we don't currently have.
I was a little confused because A, B, and C don't run in the same order as the front, but
Just the obvious statement, this is one purchase we hope we never have to deploy.
Absolutely. But it's one that you don't want to be without if it's needed.
and then the final one, because I put that on the wrong note on the wrong thing. And the final one we have on this, and I think the final project of the day of this police department, is server air conditioning unit for $25,000.
So as we mentioned before, we have several different radio sites across the town. One of them in the backcountry is actually, it's a state facility. However, our portion of that facility is, we're required to maintain it. The air conditioning system that we've had in there has been operating for about 10 years. Again, seems to be a common number there. And it keeps breaking down on us. It's obviously, we have a lot of valuable equipment in there. What was really telling to me, we all know in the last month or two, the temperatures at night have gotten down into the 40-degree range. That room in there has gone to over 100 degrees when that air conditioning has gone down. It generates a lot of heat. What scares us is that's as we're going into the colder months, it will not last when we get to the spring into summer.
And it meets the federal guidelines for an item like this to be replaced under the Equitable Sharing Act. So it's, we have to be very careful about things that are budget operating, but this, in this particular case, it fulfills meets the requirement of spending under the federal equitable sharing.
So for the most part, it appears that Public Works takes care of the equipment needs of our town departments. Why isn't this is in Public Works budget? Why is it in the,
Because they don't have an equitable sharing account of monies that don't come out of the town coffers that we already have available for such projects to support law enforcement.
so rather than Public Works doing this project, the police department is doing an air conditioning unit?
We're going to have somebody install it. We're
I'm
not going
sorry?
to put, somebody will install it, yes.
I would contrast it. So we have, I'm counting in my head, we have 5 different sites as part of our radio system. Almost every single one of those sites has a different ownership and maintenance standard. So we do have some of our sites which are town-owned, and DPW does, and we're actually in talks with them about replacing some of those air conditioning systems. So each site, we have to look at it differently. There's another site that's responsibility of one of the cell phone companies, so we're working with them. But this particular site, I can't tap someone else for it. This one, unfortunately, is our responsibility.
Okay. So I think we've now gone through all of these. I will share that at the end of the last month, Ben and Leslie and I met with you, Deputy Chief Berry, and, there were several things I think that I said that I would like to see. Number one was just to make sure that, you worked with Mr. Geiger to make sure the accounting, we've had to modify some of the accounting only to be in compliant on our own audited financial statements. So, that was, and I think that it now appears that the accounting for these 3 applications is in order. And then the second was if you would prioritize the projects. And at that point, we only had the projects that were the equivalent of what we're seeing today as PD3 and PD4. So, the list was a bit more limited. And so I think at that point in time, there were 5 projects. And my third point was, do you have any available forfeiture fund money that you could use to fund some of these projects? And, and in that case, I meant the 5 projects. So, I think very kindly attached to one of these applications, there was the information on the forfeiture fund. But then what came was an additional 3 projects, which are the cybersecurity, thin client replacement. Am I correct here? No, I'm wrong. No, I'm wrong. It's the Faro, the ballistic shields, and the server AC unit were all added, an additional $95,000. So this group currently is a total of $532,000 of interim projects that is really rather substantial. It also will take, it's nice to hire an outside vendor to do something, but my own experience, and I have lots of it in the private sector, is it always takes the management time of each of us to manage that organization too. So, again, looking at what was 5 projects, it seemed like there was a lot there, but now we're talking about 8 projects. And so I would ask you once again, can you prioritize these projects for us, you and Chief Hebe, of what you think are the most important projects, given the time frame? Because, in another, you can put any projects, say, also into the fiscal year '24 budget, and that process is basically underway now, and we'll be meeting to discuss these in February, early February. So before I call in you, Ms. Moriarty, I'm just wondering.
Well, it's relevant to this request because
Let me finish my statement. I don't
Okay.
interrupt you.
you can't call on me, but go ahead.
I know, because,
Just
but
finish your statement. Let's
so
get-
I asked, do you, I asked this a month ago, or almost a month ago. Can you help us prioritize these? And in terms of your own workload and what could be deferred to July 1, we all want safety and security for everyone. But we're also trying to manage the interim process as well, which is supposed to be emergency appropriations. And I think that people find that we are very accommodative to these emergency appropriations, both at our regular scheduled meetings and setting up special meetings to accommodate them. So I just wonder if there's a way to take 8 projects.
So like I said, I take the interim appropriation process seriously, and in the 11 years, other than things that have come up. First one was the pistol range, and if we hadn't, because what came in over budget, if we weren't able to finish it, it was going to cost us more in operating to pay for overtime for officers to travel out of town and not be available for emergencies, and the cost would have increased. So that was my first one. The second and third one were involving the additional requirement for school security, and those are recent. So again, those were necessary, and we appreciate the support for those. If you were to look at these, as I said before, we had internal and external assessments. They identified vulnerabilities, and there are consequences for not taking action on these items sooner. If it was something that we could wait, then we could do that. Now, since we were going to come to you and we recognize the additional scrutiny of an interim, the items that we had already been working on, staffing with our other members of the command staff, like the Faro machine, the ballistic vest, and the AC unit, actually the AC unit, we were able to identify those as meeting the guidelines for equitable sharing. So rather than take up your time by coming back when we were ready, because the equitable sharing would require us to present in the same format, we wouldn't be able to include that in the budget. So we tried to put it all together. So all of these projects are important, and they have consequences if we take no action on them.
Right, and I agree with you, and I too looked at the wording of what, I believe you said, and I'm not an expert on this, I'm not a lawyer. It did say, I've been chair of the law committee though, it said shared funds must be used to increase or supplement the resources of the receiving state or local law enforcement agency. And none of these projects have been approved. They are all items that, you want and will agree that you need. And so, when I looked at one of the then highlighted areas, replaces or supplants appropriated resources, I would say that one could answer no to all those questions, for every single project in this, the 8, and the increases law enforcement budget, that's what you're here for. And so any one of these 8 items, as I'm a finance person, read them, it would be a yes. And so, again, trying to, talk through this to see if there's an opportunity to prioritize.
I think I might be able to respond to some of what you're talking about. So you have
That what you're talking
8 total projects in front of you. 5 of them, were part of the interim that we initially started speaking about last month.
Right.
Of those 5, 4 out of the 5 are connected to our IT and our radio systems. And again, as I think we've kind of discussed here, they're kind of interconnected. It was difficult for us to come up with prioritizing. They're all kind of together. There's 3 out of the 8 are part of that equitable sharing. And again, as the chief mentioned, there are limits. I'd have to respectfully disagree with what you're suggesting about the use of them. As someone that has attended briefings on these, I feel very comfortable in saying that these 5 projects would not be eligible for equitable sharing dollars. They're all things that are previously existed in our budget. So if we've, the technology, the radio systems, those type of a thing of that nature, I'm very comfortable in saying that we would not be eligible to use equitable sharing, for those items. But again, of those 5 that we're coming here with the interim, 4 out of those 5 are interconnected. They're important components for us providing our service to the community. I don't see how we could really prioritize them. What we're really asking to is prioritizing the risk. How much risk do we want to accept if we defer these items? I think, I won't speak for the chief, but I think our recommendation, this is not something that we are comfortable of recommending we defer any longer on.
So again, the deferral was really 7 months. It's not like years or whatever. I just want to make clear that we're talking about readdressing this in the month of February, and we're now halfway through November. So it's not,
We can in good conscience recommend that we delay this any further.
About 90 days ago, Suffolk County on Long Island had their systems attacked. They were locked out of their dispatching services for almost a week. They were relying on paper cards to do their dispatching, where you had someone calling in a 911 call, they recorded on a paper card, and then had to walk that paper card over to a dispatcher. That's not providing, good service to the community, and that's one of the things we want to prevent from happening.
right, and that's why I suggested the word prioritize. Okay, I didn't say nothing, I just said prioritize. So Leslie, I know you've been patiently waiting.
Maybe not so patiently. I'm really concerned about your suggestion. I mean, I understand that if we look at the way the BET has voted over the past couple of years, we continue to push things down the road, we defer things as best as people make decisions with very limited information. I've certainly read the material. I'm listening to the extremely thorough presentation today, and there are real security risks that we're hearing here. Nobody can anticipate when the microwave's going to shut down or when the UPS is going to shut down. And I think it would be a shining example of bad government to say we are going to defer it so it's part of the budget cycle of an item we know that we need to fund. Certainly, you've identified that you understand the need as well. For 7 months, what appears to be on an arbitrary basis. And I don't mean to be inflammatory, but I think that that's not good financial planning. I don't think that's good support for the departments that have identified a need. We heard it on 4 of the 5 requests in PD3 and PD4 are clearly security risks. The body-worn cameras it possibly is,
Compliance.
that's compliance, right? So you can say we're going to defy the state law for another
And a
7
liability.
months.
And a liability.
Liability, and it probably provides some protection for that officer as well on their actions. So again, I think I'm not sure I can justify a reason to defer the financing of that particular aspect. It's a different kind of security concern, but it is absolutely a security concern. The grant funds, as the chief said, they have to come through us anyway, whenever they go through it. It's not really part of the budget process. It's not part of a resolution that they automatically get to appropriate these funds. So I'm not sure what is trying to be accomplished by the recommendation here or the pursuing it. I don't know what you're recommending at this point, but I just strongly object to, in this particular case, pursuing that option.
The other thing that I will say.
Let me speak first, and then I'll call on you. I just wanted to make a comment here. While I asked for prioritization, we went from 5 projects to 8 projects. Maybe I'm still at 5 projects, so I'm not talking about nothing, Leslie, but I'm talking about, a creep, even in the last month, of 3 additional projects. And I know we have a buildup of capital projects that are taking, and that includes our projects that we moved to operating from capital. They're taking a long time to be completed. There is always a time to execute and a time to do these. So there are 8 projects before us. I have been a big supporter of the police department. When the budget was cut back by 3 policemen, I remember someone initiating adding them back, and I've supported that. So I'm not supporting, I'm just saying, are there any things here that we could consider for the fiscal year '24 budget versus doing them in an interim? Because only 1 month ago, there were 5 projects, and now there are 8. And that was my point here. So Leslie I'm going to let her respond, and then I'll come to you, Jim.
Sorry. Just when you talk about the number of capital projects, I think the nature of these capital projects are different than what we have on the rest of the appropriations list. And I believe the number in the police department capital budgets is in the single digits. So you're not looking at the department that's requesting these funds that has a burdensome number of capital projects to implement.
Okay, thank you. Okay, Chief Eby.
So what I will say is that, again, we were trying to minimize your time, and we had bifurcate the 5 security and legal requirements that we have for the interims. The secondary one was the equitable sharing, which was a set of items that had been worked on by another part of our staff, and we submitted them at the same day. So it wasn't like when you didn't give us, you didn't put us on the call for a month ago that we decided to add 3 more items. Those 3 items, they were now ready for presentation so that we put them together for the same time. They're separate projects. So, and the other thing is that over the last year and a half, almost 2 years, we've been looking at, we've revamped our 15-year plan. We've looked at, some of the vulnerability in looking at maintaining our structure and all of our equipment is that, we have a building that's 12 years old. It's still, people still call it the new police building, and we had to get out of that mindset to look at making sure that we replace items before they need to be replaced. So we have been doing our due diligence. We are still cleaning up some of the lack of proper maintenance, perhaps, or kind of taking the chance to get the maximum amount of use out of a particular item. But this should cover us, and we are, again, already looking at our budget for next year and other budgets out so that we won't have to come back for an interim. It's the last thing I want to do is come back for an interim. But these are legitimate and they're reasonable, and you can't, like I said, the ones for the equitable sharing, they will produce results and they will make the officer safer. And then the other ones will reduce a vulnerability that we have identified by assessment that could have severe consequences for the town and for the police department.
So I just wanted to comment on an earlier statement that was made that interims are meant to be only used for emergencies, and I think we need to be really careful that we're not setting that as an expectation. So what I see before me are items that have been previously identified in capital budgets that were deferred, that now we're hearing that we can defer them no longer, now is the time. I'm hearing that these are items that need to be put into place for operational efficiency to minimize risk and to comply with the law. I'm hearing that for efficiency and time savings sake, which I appreciate it, but I don't know how much time we've saved here today. That 3 purchases, which I think it's a stretch to call them projects. I mean, you're purchasing 3 items under your equitable sharing agreement. I think, you're well within, that's not going to take a lot of time. So I just want to be really careful that we're not sending the wrong message to town departments. When the BET makes decisions that have a ripple effect on how departments deliver services and meet expectations that residents have, that we're not being stringent. We need to be a little more flexible. We need to be nimble. We need to appreciate where people are. Things don't always happen between January and May, right? We have to be willing to say, okay, come to us, because that is the wrong mindset to set. Don't come to us. Interims are bad. Interims are not bad. They're just the way, it's a cycle. And so we have to address them as things come up. So I just wanted to say that I support all these items. I would like to get to a vote sooner rather than later.
So I just like, again, I think I'm referring back to the charter and how the process is in place. So, I think it's always a balance, Laura. It's always a balance.
Chelsea, can
Okay.
can I say something?
Nisha.
Yeah, so I just listening to the conversation, I want to defend my colleague here, Ms. Tarkington, maybe play there's a little bit of good cop, bad cop, no pun intended, going on here. But I think there's a little bit of, in terms of how, I don't think this is poor governance. Asking questions is always a good thing. I think Ms. Tarkington is absolutely, is our responsibility to push back and say, listen, which one of these projects is really necessary? And, Chief, I hear you, you're like, I need all of these right now. And in my mind, the way I think about, prioritization, and maybe my colleagues here can agree, when you come to us for interim and you say we need these 8 or 9 things, I don't look at item number, I'm looking at the overall. You have 500,000 of projects here that you've come to us and in front of as an interim, and what I'm hearing is these are what you have felt are absolutely the highest priority for you. That's why you're coming now versus waiting till the fiscal '24 capital budget. But at the same point, I hope you appreciate the spirit of the conversation and the discussion that Ms. Tarkington is pursuing. It's really just a matter of, making sure, for example, if the Faro is the one that maybe can wait till fiscal year '24, everything else, you're right, maybe seems interconnected. I'm just using that as an example. If there are opportunities to hold off 3 or 4 months, we would love to be able to have that working relationship, because this exact same discussion happens, whether it's security, whether it's the electric car we need in Parks and Rec, or whatever. I see Joe here, whatever, right? So there's always this, we need it now. Your department is a little unique in that you provide our town security, so we never want to be in that position where we deferred and we shouldn't have. So we really want to trust your judgment on coming to us and saying, this is the highest priority. So the way I'm looking at it is, you've come to us as an interim, these are high priority items, and if you could take one off, you would, but you felt this is necessary now. So I hope you can kind of try to play a little bit of both sides there, but I intend to support these items simply because of how you've come in front of us. But I also want to acknowledge the hard work that Ms. Tarkington is doing here and asking those questions, which is tough to do in our spot as well.
Motion?
So I think we start out with PD3.
I'll make a motion to approve PD3 capital expenditures of $295,000.
And I'll second that.
Okay, so I will move to amend to defer $250,000 of that amount for the fiscal year 24 budget. And
Is there a second?
I hear no second, so I'll take a vote on that motion, the original motion, made by Ms. Moriarty, seconded by Ms. Aurora. So those in favor?
Aye.
And I will abstain. So that vote is 3-0-1.
If I could make a motion for PD4, for additional appropriation in operating expenses of $142,000.
Is there a second to Ms. Moriarty's motion? You're breaking it down into cybersecurity for $55,000, then client replacement of $47,000, and body-worn cameras for $40,000, Leslie?
That's in the supporting documentation. Since it is operating funds, if we approve it,
I don't know, Leslie, because haven't we created special lines like for computer equipment and so forth? I don't know the answer to this.
the chief always has the authority to move funds within his department. So yes, we're approving it with that intent, but just so you know that they do, if cybersecurity comes in at 57 and thin client service at 45, they're permitted to cover those expenses. And Mr. Geiger will correct me if I'm wrong.
Yeah, can we stop here and have just a little conversation here? Because that, Roland, can you help us in terms of what's happening when we've moved? We're going to track these as capital move to operating. So in this program that we've been sort of moving ahead in order to track this and make sure at least it works initially, we haven't really thought of what Leslie is saying here, right? I mean, I want to just make sure I understand too. You created different line items so that we can track each one of these.
We've done, if the department needs a separate or sub-account, we'll set it up if we need a sub-account to track it, yes.
Right, so these are going to be into separate sub-accounts because these are capital moved into operating. This is equivalent.
But they're tracked that way, but they have the budgetary authority to transfer funds among operating accounts. Isn't that correct?
That's correct.
That is correct. I agree with you.
We'll be able to identify the amounts and the transfers after the fact, but we are.
I agree with you on that point. There's no question about that.
So,
But that's not, sort of, we're creating complexity here in this conversation that we need to talk probably in January or something, February.
If I can interject one thing. Yes, a department head can move between
Right.
accounts, but between your 100s, 200s, 300s, and 400s is something that you'd be back here having the discussion about moving.
No, but we're talking about moving capital items, Tom, to operating. It's much more technical than that at the moment, so it's different than that. But I agree with all the technical things. We'll have to talk about this offline. Okay, so, I'm sorry, Nisha, you seconded that one or not?
I will second it, yeah.
Okay, so PD4 was moved by Leslie, seconded by Nisha, and I'll take a vote on that one. So that vote is 4-0-0.
And can I continue?
Yes,
Make a
please.
motion to approve PD5, which is the request for use of grant funds of $95,000.
And I'll second that.
And I will make a motion to delete for the defer until the fiscal year '24 budget, $85,000 of that amount, leaving in the ballistic shields. Is there a second to that motion?
Do you want
So-
to Leslie, do you want to maybe just do the Pharaoh, the 60,000?
I'm sorry?
Just asking you
Okay.
to amend your amendment
Okay,
if
so-
you'd like.
Okay, so I will,
did I
I will
understand-
amend my amendment. I withdraw my amendment because it wasn't seconded, and I will make a motion to, I'm sorry, to delete $60,000. I mean, is that what I'm trying to say? Delete $60,000 from Leslie's motion of $95,000. So it would be for $35,000. Is there a second?
And I'll second that, yeah.
Okay.
Can I ask a question? Those are for accepting and using grant funds.
Correct.
So you're tying the use of those grant funds to a separate motion we would make during the budget process?
Why is that a grant fund? I'm sorry, I guess I didn't follow that part.
There-
This is
Equitable
a,
sharing fund, it's money that we have and have had for many years. I haven't touched in like 9 or 10 years, and it's for this equipment. So, so I could reapply every month for the same thing, like, because it's a requirement. You know, it's a grant money, that's not budget money.
so
A lot of this
you
is-
might, how much do you have in the equitable fund at this point?
I'd probably look at Roland for an exact number. I want to say it's about $150,000.
Under 200.
What is it?
It's under 200.
A lot of these dollars are seized drug money, forfeiture from convictions, things of that nature.
And we have not received any money into that account for a number of years, but we have not spent it.
And you have specific purposes? you can
Previous
use
to
it?
this, the last time we went into the Equitable Sharing Fund was to purchase heavier vests for active shooters for the officers in the patrol cars. So we're rather judicious about it, and it has a value to have that money in reserve if there is something that we can't get through the normal budgetary process.
So, I asked whether you had these funds available and whether it could be used for any of the other 5 items, so I just find the timing is interesting.
So, and I just want to make it clear, the other 5 items do not qualify under the equitable sharing. And I'll provide you and the chairman of the BET a copy of the guidelines so that we're clear.
Right. So, so those in favor of I'm sorry.
Just
Would
to
you
make
comment?
one other motion as before we vote, the relevant kind of analysis you should think about these grant funds, or what are the alternative uses? Is there a better use? We're hearing the police chief telling us this is the best use of these funds and has his support.
Yes, I'm not sure where we are on the motion, but I'm okay supporting this as is. I know just to clarify, because I didn't recognize that this was just specifically coming from
There was
the
what?
grant. Yeah, I'm sorry, I didn't recognize that.
So we'll the motion was moved and seconded, so now we'll take a vote. And the vote on the motion to reduce
By $60,000.
by $60,000 is those in favor, 1. Those opposed, 3. Okay, so the vote on that motion is 1-3, and it failed. And now a vote on the original motion.
Aye.
And Laura? And so that vote is going to be, and I'm going to abstain once again, and that vote is going to be 3-0-1. Okay, so we thank you very much for your time and all your explanations. We also thank,
Routine or non-routine?
what do people want, routine or non-routine? We've got how many people here? I don't know. I would say,
routine, given the length of time
okay, routine.
that the officers have spent
And
with
they
us.
can, it's all on television and YouTube Live anyway. They can go into the tape.
And if the chair wants to change that, he'll let you know.
Right. Okay, so we'll do all those as routine from us. So thank you. Yes. If not routine, then you'll hear from the chair. Okay, so, I'm sorry?
I don't need the sense of netting on the golf course. Me personally. My ball doesn't go that far.
So, you're going to, thank you for being so patient, Mr. Siciliano, and Joe Siciliano, the head of our Parks and Recreation Department. And would you like to introduce your new person?
Dan Carlson, our new Assistant Director. Just go
Exact-
easy on him. This is his first BET committee meeting. So he's getting quite the education. So I'm here to represent application PR1, $125,000 request from the golf course revolving fund account, which just for this statement, that these are the fees generated by the golfers and the golf course revenue. And so we're requesting this opportunity to put up some additional netting, the height of the netting, and a couple of other sections. If I didn't witness this myself in September, which I did, that somebody playing on the first tee came very close to getting hit from golf balls that are getting projected over the current net that we have at the range. We have a 50-foot net right now, and the last few sections, 6 sections, we want to go up another 20 feet to make it 70 feet and on the first fairway. And then we've noticed that we could use 2 more sections on the road side of netting. So we're here to put this complete package together. If I didn't think that this was an emergency or a real safety issue, I would put it in the budget for next year. But if you think about it, if we don't get the money till July, we won't be able to do the work till next year this time, November or so, and that would allow us to have this whole situation exist for the whole entire golf season next year. So I'm not in favor of coming back and spending my time, doing this and your time, but I think it's important enough, and it is a safety risk. And with technology being the way it is, golf clubs and golf balls, people want to hit a full set of golf clubs at the range. They don't want to hit short, it's just only irons. They want, and so that the golf course, how the golf course range works is that it's part of the pro contract. We get 50% of the revenue that comes from the range without any expense. We obviously we maintain the net and we cut the grass, but all the golf balls, all the mats, all the labor to pick up all the balls, all of that is provided by the golf pro. Our last year's revenue from the range was $131,000. That's just our share. So it is widely used, and I look at it as a safety issue that I really don't think I want to wait another full season to kind of see what I saw this year in September when I was out on the course, and I wasn't playing golf. I was just there to kind of look at certain conditions, and this one really popped up. So I'm here asking for the use of this funds, and as I said, it'll come out of the golf course operating revenue or the fund balance from the revolving fund. That's my story.
Joe, just a question, and welcome, Dan. You said the nets are regularly maintained. Can you tell us how often they're maintained? Sometimes I know people rip those golf balls and they go right through the netting.
There's always spacing on every netting, but what usually the maintenance on the netting has to come down if we get a snow load. Sometimes we've had deer run through the netting and, they've ripped it. But, every other year or so, we have to put up a small section or do some maintenance. We get the company to come in and piece it back together for us and stuff. This is completely different. These are new additional sections.
Right, I see that. Am I to infer that most people have a hook?
Excuse me?
Am I to infer that most people have a hook on the driving range since you're
could.
going 70 feet on the left and only 50 on the right?
We'd rather have a hook than a slice because the slice goes onto the road.
Right.
So,
If they're righties, right. So one last question. Are we comfortable, because I know lessons are given and clinics are given at the far end of the range, are we comfortable that this new technology, that those people taking lessons, giving lessons, taking clinics aren't at any risk?
Well, I think we're only doing the best that we can. I mean, in the sense that in order to change what we do, putting up another 20 feet here is a better opportunity. It'll knock down more balls, but, different driving ranges, we'd have to tear down both nets on both sides and probably go to 100-foot
Yeah, no, I think you're
concrete or steel pole
I think you're
opportunity.
taking appropriate steps. I support this item. I'm just want to be sure that with advanced golf technology that people aren't going to get down to the end of the range where they are giving lessons.
Well,
The other option is to use, different kind of golf balls, right?
but we do use golf range balls, which are not as they're not regular golf balls. They're so that they are to a certain degree, inhibiting them to really going too far. But still, the clubs that they're using still drive that kind of technology, even with the golf balls that are designed for range use only. So it's not like you're buying a set of, we're using regular golf balls that can maximize distance. But at the end of the day, I mean, there's always a risk here that you're going to get some unusual hitter, some person that can hit unusually long shots. But we feel that, from doing this assessment, especially with the company that we've talked to that does our netting work, they maintain a lot of ranges that we would be in a much better position to knock down some of those balls than we would, than not. I mean, right now, I think we're seeing a reasonable number of balls going over the net.
Just following up, how often does one, refurbish the nets or something to address the issues that Laura's talking about?
Well, I think, each course has to do that. I mean,
No, I'm talking about the Griff, just,
At the Griff, I mean, there were years where we had no netting. We only had trees planted. Then we went to the 50-foot netting on both sides of the range because, the range became a lot more popular. Right now, the range is very popular. Arrowwood closed their range, so we're getting the extra people that would play over at Arrowwood or use their range. And, but, you'd have to do this. And if we start to do some significant changes to the range as far as like the netting goes, we'd also want to look at the land. I mean, right now it's a kind of a wet area. We'd want to install some different types of drainage. People look at double deckers, people look at lights, all that kind of stuff. I mean, ranges are really, they're money-making opportunities to support, golf courses and the golfing public. So, I mean, yeah, is this the ideal situation? No, but it is a whole lot better than what we're currently looking at without probably a $500,000 expenditure to put up netting on both sides.
And how long does it take to do this work, Joe? I mean, because you're sticking,
well, he's just going to add extensions to the poles and put up the new netting. I would imagine he can do all of this within 30 days. So we're looking at the winter opportunity to do this before we reopen the range in the spring, whatever window that's going to be with weather, so that we can get it done before we open the range in the spring.
What's kind of the standard protocol like other clubs, like the private clubs? Do they all have 70-foot netting or?
I guess it depends. It depends on the topography of your range. Where it's slated. I know some ranges. I know clubs that have no netting whatsoever. It just depends how it's located and what you're trying to protect. On this case,
I guess I'm just trying to understand: is this something that is standard, or are we going above and beyond? I guess the first question and the second.
No, I think we're in the reasonable zone here. I mean, some clubs have no netting at all because they're not bordering the first tee or a roadway. They're just in the middle of somewhere. So I think this is a reasonable approach. It definitely, I mean, is it 100% foolproof? I can't guarantee that. But at least we can demonstrate if a ball goes over the net and somebody gets hit with it, that we did our best to address an urgent issue.
Yeah, I guess that was the second part of my question. What kind of prompted, I was just commenting, my balls don't go this far, so this is not an issue for me. That's why I was wondering how much netting that I'm typically used to seeing. But I have, of course, seen balls go across the driving range and hit a fairway at different clubs. But kind of what prompted you to do this? Did somebody almost get hit? Did you see a lot of more balls? Is there any kind of metric that you're using? Well, now we saw 5 balls going high.
What prompted me is I was there. I saw somebody else, I was there when somebody else got hit that day.
So just that one, I'm just saying that one incident.
Well, it's one incident. Then I went back and talked to some of the people, and they talked to the pro, and he said, well, yeah, I mean, we've been, we pick up, a couple dozen balls or so every day over the first fairway. I go, well, we should address this. And yeah, I could put this in the budget, but at the end of the day, we're going to lose a whole season.
No, I'm just trying to understand what.
Yeah, I mean, it prompted me because I actually saw someone almost get hit on the first fairway.
And then the second was, do you get, I mean, this seems very expensive to me for just nets, and I don't know how much any of this stuff costs, but do you get multiple quotes on stuff like this when you do, or you just go to your go-to provider and?
Well, we can, but, this was the guy who was the original installer of the equipment. I mean, he comes back from time to time and patches out netting sections and stuff. I mean, we could get probably three quotes on it. I don't know how many companies in the area really do this work.
Yeah.
but I'm sure there's some
Yeah, I
others.
just think it's a good protocol, just, you
Yeah,
know.
I'm sure there's
because
some more.
Especially on stuff like this, which is.
If we get the funding gets approved, we'll do whatever we need to do from the purchasing aspect to make, to get the project moving. We want to do it between December and April 1st, finish it.
No, I think, just from a process standpoint, I think it's fine for whatever this, but generally speaking, I think it'd be nice to have a sense of, like, I don't think any of us knows here whether this should be a 40,000 project, an 80,000 project, or $120,000 project. I mean, this is, obviously, the guy you go to is going to give you a number, and you have to take it because we're a price taker in this case.
No, I mean, we don't have to take his price, but what we can do is, we can see if there's any other companies out there that do this service
Yeah.
and ask them for at least a quote.
No, and I'm just talking generally,
Yeah.
Joe, not only on this project, but generally all projects. It's probably just good practice to get.
They've used it
Okay.
before and they
Multiple quotes,
patch and everything else, I really don't know. Oh,
Whatever you guys want to do on this. Yeah.
I'll make a motion to approve PR1, an additional appropriation for $125,000 for driving range netting.
No, second.
Motion by Ms. Moriarty, seconded by Ms. Aurora. Those in favor? 400. There you go, Joe.
Thank you.
Off to the
See,
RTM.
Dan, how easy was that?
You guys made me sweat a little bit there, not gonna lie. No, I'm just kidding. It was very good. Thank you guys very much.
We made it easy for you the first time.
For the first
But wait
time,
until
right?
the second time.
Yep, one free pass. Thank you guys so much.
I think we finally made our way to the economic conditions report.
If you look at the conveyance taxes and building permits, they,
Is your mic on?
if you look at the conveyance and building taxes, you'll see that they're sort of slowing down. However, Pete just told me that we collected $195,000 today on one sale. So maybe next month we'll be back up again. In the case of the interest, that's down, but that's only because the cash balances are dropping each month. So we don't have as much cash to invest, but that'll go back up in January when we collect the second half of the taxes. And we're already over budget by $300,000 on interest. So that's continuing to look good. On the other revenues,
No, I just want to comment that, I mean, quite frankly, you're right in terms of the, say, conveyance taxes, it's down, but, it's only down from, the peak of the COVID period. If you go pre-COVID, these numbers are still substantially above what we were doing before, so we're very fortunate so far in this fiscal year.
staying strong, yes.
Yeah, and then I would say, again, for building permits, I think it's amazingly strong. It wasn't that long ago, in fiscal year 18, it was only $1.5 million, and it's $1.9 million for the equivalent period. So I'd say so far, so good on these fronts.
Yep. On the rest of the revenues, probably the biggest items is the higher taxes, higher tax revenue is offset by the lack of bridge revenue so far. We got a lot early on last year, at least in the first half, and that accounts for most of the differences in the revenues.
So Roland, this comes to a topic that maybe we're going to have if we have a couple minutes at the end. Is it just that we're not collecting them, or we're not doing as many bridges right now? Do we know the reasoning?
That I don't know.
Okay, thank you.
It always feels like it always feels like kind of random when
Yeah.
these funds come in
I
from
agree.
the state. It's not routine. I wanted to ask one question on ECS and the special ed funding from the state. Is there a regular calendar that they distribute that, or is it arbitrary from the state?
The ECS and SPED, if you look at the state budget, they come in, and the ECS, I don't know the exact months, they come in 25%, 25%, and 50%, and I think the SPED is 75, 25. But let me follow up on that, because there's defined periods where it's payable.
Both the ECS, I mean, I'm just noticing that we have some revenue noted for fiscal '21, but we haven't received anything for fiscal '22 yet, so you'll follow.
In the case of the SPED, there's.
That's ECS, that's not SPED.
Okay. But one more, the comment I just made is, last year, they resubmitted their SPED request. Special education has a formula, I think it's 4.5% of the per pupil, 4.5 times. Yeah, but they resubmitted it, and it's a reimbursement on a prior year's expenditures, and we got, I think, over $600,000 late in the year last year.
When in previous years, when the state was in some more fiscal difficulties, they would cut back, not give us our full amount that we were entitled to. I don't know what they're doing now, but I also note from attending Board of Ed meetings that they're making a concerted effort to account for our expenditures in this area in a way that more of our expenditures are captured by this. Specifically, as I think we all know, that there's the out-of-district tuition, which is a tuition they pay to state-approved schools, and then there's something under the SPED settlements, and that settlements are really just payments to family for that same tuition. What they've discovered is some of those tuition payments were going to schools that were approved by the state. So the Board of Ed is now accounting for those within tuition to get it eligible for the state reimbursement. So they're focusing on that in order to improve the overall revenue picture for the town.
That's great. Did you have any idea marginally how much no,
I don't.
Too early.
I don't. But last year's full year SPED excess cost amount was greater than we had received in multiple years. I don't recall the number, and I think I'm correct with that statement, but we've seen the upward trend already in last year.
On the expenses, we have fire and police are higher this year than last year. One of the reasons is we didn't have the contract yet for the fire department in the first part of the year. That was kind of hit with a lump sum, I believe it was November, December, which is why those are higher. And the police, we're seeing part of that is the movement into operating from capital. The expenses that we took out of capital and put them into operating.
Yes.
Sorry, we moved on to expenses, but I had a question on revenue. Of course. Going back to Nathaniel Witherall, both Medicare A and Medicaid are down from last year, and I know we've talked about the receivables. Is this related to that?
No, we don't have their October revenues yet.
Okay, thank you.
So if you add $2.5 million to their revenues, you're kind of in line with where they were last year.
Thank you.
So just, because things fall a certain way, just make a comment that the Bureau of Labor Statistics came out with a CPI-U for our area, I believe it was last Thursday, and the inflation rate annualized historically is now at 6%, and approximately in the summer, or I think it was July, it was at 6.7%. It's been falling every month, and also the monthly rate is at 0.1, and that also is a decline over the last couple of months. So we've been softer than the others. So I think our next thing, thank you, Roland, very much. Our next item on the agenda is our minutes of the October 12th regular meeting and the October 17th, 2022 special meeting. I think Laura pointed out a tiny little nit yesterday. and
Well, it
that
was a
was
$50 million
Oh, it was
difference.
$50 million. I agree. It was a numerical, but it was a,
Typo.
it was a typo. And so that was changed and posted yesterday morning early before the 1 o'clock, 24 hours, although I think I've just learned something different from Barbara. We can substitute and post up, this is Laura's point, up to, if we make corrections. And also, we didn't do the same. Leslie circulated some comments that she wanted change on her comments on the budget guidelines, and they were also accepted. So is there any motion on the minutes?
I'll make a motion to approve the October 12th, 2022 regular meeting minutes as modified.
Yeah, fine.
And I'll second.
Will you take them together? Are you willing to do that?
And the October 17, 2022 minutes as presented.
And I'll second.
Okay, so that's, and so that, those in favor?
Aye.
Okay, so our next meeting is scheduled for Tuesday, December 6th. And Leslie and I had talked ever so briefly yesterday and didn't have a chance really to complete that conversation. But just talk a little bit about the agendas as we look forward. December will have, if you don't mind, if we just mention a couple things. December will have our subject to release conditions for TAG and GEMS. We also, I think Leslie has suggested that over the next couple of months, we begin to look at, if we can, in our new business area, a couple of areas, obviously to go through open capital. We have a lot of open capital. That was one report. I think at some point in time, maybe it's, and I welcome comments in so we can start scheduling for our budget meetings. Probably in the budget meeting, near the beginning, take an hour or something and just go through all of the ARP and ESSA and so forth, those, but just suggested we look at open capital, so sometime perhaps in December or January, we can look at that. I think Leslie also suggested that we look at the bridges, and that seemed to be very appropriate based on, get a report on reimbursements and progress and so forth, just on, a bridge report we used to get, and somehow in the last couple of years, we have not gotten it, and I think that would be very useful.
I think they have supplied it, it just did discussed it, right? So we got it as a written document. But if we have time in January, in anticipation of a DPW meeting, it could be something that they may have ready for our committee to
I don't
look at.
remember it last year, maybe I missed it,
I think it was,
because I remember talking with Amy about it in one of our liaison
The information was presented in a different format, but the
Yeah, so
information was
sort of all-
presented.
It was kind of all over the place. It used to be in like a little report. I think also, we don't know what's going to happen on the Round Hill Volunteer Firehouse, what they'll be doing, but if I were going back a month, I would say that there would be release of conditions on that, but I don't know. That would probably be no earlier than January, just in terms of thinking ahead. I think we, need to look ahead at some of these things. I don't know. I expect January. I don't know whether we're going to have a release of conditions on the Nathaniel Weatherall, because there is the public meeting, I believe it's on the 15th of December, and there's a condition there. So that probably will go on the January agenda.
So part of that condition, it was a three-part condition. It was the Nathaniel Witherall Board, the BET, and the Board of Selectmen. So the BET does have a role to play. I don't think we've codified how we're going to have that discussion, so that's something for our chair to think about.
And maybe the liaisons, working with the chair. Or whatever, I'm happy to work there too. I'm not moving on. But, I'm just trying to put things out there that we have quite a bit coming up over the next couple of months, in addition to beginning to contemplate the fiscal year '24 budget. I'm not, this is,
If I could just add, I did attend the Nathaniel Witherell Board meeting last night, and there's a possibility of an interim coming to us in December relating to some out-of-compliance equipment in the kitchen.
thank you. Is it maybe, well, I mean,
In terms of the amount or the work, I think there's more that needs to be done. I think the amount was $150,000.
thank you, Laura. And then, I guess the other thing that I'm not quite sure what's going on. So we have Nathaniel Witherall, maybe, subject to release. We have maybe Greenwich Avenue intersection, subject to release. That went through the Board of Selectmen for MI, so that's coming up. I don't know whether, report on the status of the ice rink. Anyway, there's a lot of different things. I think if people send things in, enrollment for the schools is another. I think the whole point here is, what do we need to do to both organize our fiscal year '24 budget meetings, as well as what do we need to address that will be in addition to the meetings, as extra new business topics over the next couple months. Laura, again.
I was just going to say, if we can take some time in our December and January meeting to start talking about the hearings that will be held mostly in February, early March, about what our expectations are. Last year we had a lot of, Nisha and I were new to the process, but we had a lot of information requests, a lot of, how do we synthesize all this information? So maybe we can discuss amongst the four of us how we are approaching the hearings now that we have 1 year under our belt.
Sounds like a good idea. Any other comments? This is just casual discussion.
If you want information about one other potential additional appropriation coming, the Board of Ed tomorrow night will be looking at a report from the High School Entryway Building Committee. If you remember, or you may not know, the initial design came in significantly over the appropriation. The Building Committee was asked to look at scaling back the project and focusing mostly on security and less on creating a new entryway, and the Building Committee has done that. I'll circulate the package to the full BET that's going to the Board of Ed tomorrow night, but the new design is still $500,000 over, mostly because of two issues not included in the educational specification. One is landscaping scope added by P&Z, and the other is protection of still remaining windows that face the front entrance that won't be covered by the new building. So, but I'll send that documentation. And I don't know how the Board of Ed will vote and handle that issue.
Okay. Anything else, Nisha? You set? Okay, so a motion to adjourn?
Motion to adjourn at 4:26.
No second.
Those in favor? 400.